No sound. Ten. And Smartline Pet Products. Smart Pets Trust Smartline, distributed by It's a Dog's World, 2A Birchicle Lane, Kingston 6. And True, simply better pet food, member of the Seabreed Group of Companies, 27 Upper Waterloo Road, Kingston 10. Thank you for all our sponsors making this conference possible.
Good afternoon. Good afternoon. Thank you, everybody. Thanks so much for joining us for day 2 of the One Health Conference Jamaica, brought to you by the Caribbean College of Family Physicians and the Jamaica Veterinary Medical Association, JVMA. I am Samuel from Oldgate Solutions, and again, it's a wonderful pleasure to welcome you all for day 2 of this wonderful One Health Conference. We had an amazing day 1, and we know that day 2 is going to be equally as amazing. I'm going to hand you over now to the capable hands of our moderator for day 2, Dr. Kathy-Ann Leon. Doc, over to you.
Thanks, Sam. Good afternoon, everybody. Welcome back. Well, I shouldn't say welcome back. Welcome to day 2. Welcome back to those who were at day 1. And again, I am Kathy Leon, the president of the Jamaica Veterinary Medical Association. And I am looking through, let me see, participants so far, 193 and counting. I love that. And the chat is super active. Hello, everyone. Good day, all. Good afternoon. Lots of good afternoons going around. Good afternoon to you, too. We just hit the 200 mark. And I don't know who saw the video, the sponsorship video, but I just want to open with a greeting to you guys on behalf of the Jamaica Veterinary Medical Association. So, welcome to day 2 of the One Health Conference, Jamaica, a collaborative event between the Jamaica chapter of the Caribbean College of Family Physicians and the Jamaica Veterinary Medical Association. This conference has become such a staple. It is difficult to imagine a year without it. In fact, I remember when it used to be face-to-face, and we never had the kind of attendance that we do now and the type of attendees that we do now. Doctors of all types, human doctor, animal doctor, teeth doctor, mind doctor, thesis doctor, and now several non-doctor experts attend because together we understand how important it is to have one mindset regarding One Health, especially in the fast-paced evolution of the world today. Perhaps the biggest challenge to be faced will be the effect of AI on the development of the minds of future generations. Something like how our smartly built smart machines made us simpletons, or maybe it will be another epidemic. You know, difficult to rule out as H5N1 spreads across America, infecting wild bird populations that migrate and rest in Jamaica, close to our chicken farms, which also often house pig farms on the same premises. And then you have people working between the two. And then bam, we have a human case. MDs, did you even think about that? But I digress-ish. What I'm trying to say is similar to the theme for World Veterinary Day this year, which is Animal Health Takes a Team. I continue to extol that One Health, that is achieving success in planetary health, animal health, human health, requires a team. And I pray that today, as you listen, you garner the tools and wisdom you need to make the changes that will guarantee this success. So please, please, please enjoy day 2 of our conference. And with that said, I go back to moderating now, as that was a message from the president. And I want to introduce to you, without any further ado, our first speaker, who will be speaking on One Health workforce development for pandemic prevention. And that is Professor Latiffah Hassan.
So before that, I think, Doc, let's go with the One Health prayer.
Oh, we haven't done that yet? I thought that was before me.
It was before you, but I made that mistake. I apologize.
I see. Go ahead.
Thank you so much.
Let us pray. O God, our Heavenly Father, nothing can be achieved without us acknowledging your presence. And every day that a patient and an animal is cured through our hands, it is because of your will. Enter into our hearts today, we pray, and help us to continue our respective medical practices in good faith and honesty. Lead us, Heavenly Father, through life's tempestuous seas, and teach us, dear God, to remember that whatever we do, we are serving you. Have mercy on each and every one of us as we ask you to hear this our prayer. Amen.
Amen. Okay. So, Sam, I can moderate now? Yes?
Sorry about that. Yes, you can.
All right. So again, let me introduce Professor Latiffah Hassan, a Malaysian veterinarian with expertise in veterinary public health and epidemiology. She has been teaching, researching, and serving at the Faculty of Veterinary Medicine, University Putra, Malaysia for over 2 decades. During her tenure, she has made significant contributions to the field of zoonotic diseases, food safety, and antimicrobial resistance, publishing more than 100 articles, book chapters, training modules, and disease protocols. In the past decade, Dr. Hassan has played a crucial role in enhancing One Health workforce capacities in Malaysia and Southeast Asia by strategizing training programs and fostering numerous intersectoral engagements. She holds a Doctor of Veterinary Medicine from University Putra, Malaysia, and a PhD in Veterinary Epidemiology from Cornell University. She is currently the co-chair of the Commission on Prevention of Viral Spillover, established by Lancet, and the Coalition for Preventing Pandemics at the Source, and an advisory board member for the University California Global Health Institute. Please put those emoji buttons on and welcome Professor Latiffah Hassan. Lots of love, please. Yes, I see those emojis, emojis, emojis. Prof. Hassan, sorry. Over to
All
you.
right. Thank you, Dr. Kathy, and thank you so much, Secretariat, for the conference, for inviting me. I'm very, very honored to be here. And I want to thank also Adana. I think she's in the audience. I saw her coming in. So Adana is the one who connected me to you. So really, really happy to be here. And I love the One Health prayer. I think that's it's really heartfelt, and really we need more of that. I think every single day with the competing challenges and competing tragedy and atrocities around the world, we need more of that for sure. So Wagwan, is that the right way to say hello? I guess I educated myself on how to say hello at least
Well,
to
go on.
you. Wagwan, very good afternoon. So I'm gonna share my screen right now. So I think I almost forgot to do that because I'm just so happy to see everybody.
Perfect.
Okay, wonderful. I hope you can see that. So the topic that I've chosen to give to you today is One Health Workforce for Pandemic Prevention. It's something that I'm very comfortable talking about, even though the science of One Health Workforce Development, it's not an exact science, right? It's very contextual. It depends on where you are. It depends on what kind of like resources you have. So whatever I'm giving you today is basically based on my experiences, I guess, in Southeast Asia, in Malaysia, and also what I know about the conversation, the global conversations about developing one health workforce, especially when we're thinking about the looming threats like emerging diseases, emerging zoonoses, pandemic prevention, issues with AMR and all that. Definitely, we need a different set of workforce compared to perhaps traditionally what we are used to. So I'm gonna frame my talk a little bit. I know I have 30 minutes, but I have like 60 slides, so it's gonna be like really quick. And I hope my computer will not fail on me because I'm holding the cable right now. We will not charge for whatever reason, so hopefully it'll remain. So I'll talk a little bit on what is One Health Workforce. I know all of you are probably very familiar about One Health, so we're not going to go into the whole like definition and all the boring stuff. We'll go ahead and jump into what is One Health Workforce. Why do we need them? What's so special about the situations right now by which we need this workforce? The looming threat and how it is unique to justify why we need One Health, and why we need to act in a different way rather than simplistic kind of like actions and strategies to cater to like really non-complex problems. We're going to talk about maybe why we need this One Health workforce because of the nature of the public health issues and health system issues that we have currently, which requires pluralistic actions. And I'll introduce you some of the resources for enhancing One Health workforce. I know probably we have too much information, and there's that sense of like fatigueness of too much information. But I'll direct you to some that I think is quite relevant and perhaps can be used for Jamaica society and community as you move forward into thinking about developing One Health in your country. And challenges in building One Health workforce. These are challenges by which we have seen in my part of the world as we try to build up that workforce capacity in the past decade, which possibly could also be applicable to your situation. And then I'll in 2 slides, I'll introduce to One Health Workforce project in Southeast Asia. And I know Jamaica was part of the One Health, One Love movement, right? I think my friend Adana, my good friend Adana is the director leading that effort at one time. So we'll go into what is One Health workforce to make sure that everybody's understanding and have the same foundational understanding about what one workforce is. Workforce is a total number of people in a country or region who are physically able to do a job and are available to work. So in One Health definition, this includes also the student, because they will be feeding into the field basically and into the workforce sectors. So that is included in the One Health workforce definition. So that this definition is by Collins Dictionary. So under the USAID, as we are thinking about One Health workforce, about a decade ago, there's no such thing. So, and then as we're thinking about this, the complexity about situations and what One Health workforce are, so it is a workforce that understand the complexity of collaboration. Collaboration traditionally is not something that is natural to many sectors, right? Everybody works in silo. They're very comfortable in their own little niche. So that collaborative effort is not, it's not natural. Yeah, and even to this day, there are countries by which government sectors have never actually sat at the same table to talk about a common issue. So that is given and it's happening. But I think the trajectory is changing. The way that people are talking is changing, and that's a good thing. And this workforce possess a mindset and skill set to tackle One Health challenges such as emerging infectious disease and AMR. One Health workforce is a sum of its parts. Basically, individual does not make the One Health workforce. It is a sum of its part, because collaborative work requires each individual worker to have one, technical skills and competencies to work well within their own discipline and sectors. Yeah, One Health doesn't mean that you have to forget about your own field and then you have to be an expert in every single field out there. No, it means that you need to know your field well, but you also need to have the skills to work cross-sectorally and to be competent to work collaboratively across sectors. And number 3, we need an environment, a supportive environment and institution to enable that collaborative work. Okay, so basically you need a good boss, a boss who understands that to tackle a problem, you cannot work in silo. So One Health workforce are students, faculty, government, and private sectors workers with the ability to mobilize and respond to new and existing disease challenges. So again, One Health worker has one, technical expertise. Well, we need vets, definitely. We need human health. We need medical doctors, definitely. We need environmental scientists, definitely. Okay, so you need to have a strong foundation in that. And more importantly, for One Health workers, we need collaborative mindset. You have to be trained in interprofessional collaboration, including communication, teamwork, and shared decision-making. This is not natural and to many curriculum. At the university, this is not professional. This professional kind of like teaching is not taught, at least not in Malaysia, and also in many parts of Southeast Asia. And to understand the value of diverse perspective and interconnectedness of human, animal, and environmental health. So I'm just showing you what we have developed in Southeast Asia. This was like a decade ago when we started off with this movement, One Health movement in Southeast Asia. So locally, we have to decide what kind of competencies we want for our One Health workers to have in order for them to talk in the same language. So then we develop the technical competencies and then also the core competencies. So the technical competencies, it is fine, right? Everybody has their own very sector-specific competencies. But what is very important, but perhaps not very fully emphasized until One Health came along, was the core competencies, such as in Southeast Asia, definitely we're thinking that collaboration and partnership is a very important skill. Communication, informatics, that's another one. And then leadership, management, policy, advocacy, cultural beliefs and value and ethics, and systems thinking. Those are core competencies that you may not get in every single technical specific kind of like education, but that is necessary for One Health workforce. So using this module, we have trained in Southeast Asia about 52,000 university students and also people working at the ministries and the academicians. So workforce development should be an ongoing thing because it's a process of identifying and addressing the needs of a local workforce to improve productivity and competitiveness. So in a sense, for example, in Jamaica, as you are moving, I understood that you got your pandemic fund. And as you are moving into making use of that pandemic fund, if you have not already, perhaps you have, it is very, very crucial that you identify your local needs, identify what is the gap, identify what kind of help you need, identify what you can do yourself as well. Because then only can you be able to articulate what you need, even though you are funded by international or like, some external sources. And this includes planning, training, developing policies and educational programs, not just educational programs for ministerial offices or those who are already in the sectors, but also educational programs for students in the university that will be serving these ministries. So at its core, workforce development focuses on building a strong, sustainable labor supply that can meet the demands of a particular community of origin. So this process is critical component of ensuring a resilient and adaptable workforce to serve the national and local communities in all situations, during times of peace and in times of crisis. And we just came out from COVID-19, how during COVID-19, right? During COVID-19, a lot of things is exposed, right? There's a lot of issues that are exposed. And of course, that's very contextual depending on which country you are and which geography and location you are. But you yourself perhaps could have identified or would have done your homework to identify what would be necessary to prevent what happened during COVID-19 to happen again. So the workforce needs to be resilient because preparedness and ability of the prevention and response to cope, recover, and adapt to the challenges, uncertainties, and changes of infectious disease threats across human, animal, and environment health domains. So you need to have a resilient workforce to make sure that they can adapt to changes. And that's a very tough thing to do. It's very complex unless we continue to train our staff and our ministerial offices and to expose our students in a way by which they are prepared in terms of mental and perhaps emotional capacity as they are heading into the workforce. So why do we need a One Health workforce? This is a departure from business as usual, right? It's quite easy perhaps to train a person to be engineers or medical doctors and veterinarian or social scientists. But to make a One Health workforce requires you to understand almost all of this, at least to appreciate the importance of that. So that's a departure from business as usual. You probably are familiar with this figure. I'm sure people have shown you this before. Now, historically, we have been, we have suffered from multiple epidemics and global pandemics, throughout centuries. So some of the pandemic had killed like almost, 1/3 of a continent at that time. But recently, for the past 30 years or so, perhaps starting the early 1900s, we're seeing more and more epidemics and outbreaks and pandemics. So this started off with perhaps Spanish flu, which is like, I guess, the worst pandemic that occurred. And Spanish flu, if I don't know whether how many of you are in touch with the latest information about Spanish flu. When they dug up the historical samples and things, they suspected that actually Spanish flu have a zoonotic origin. So, and then you have the Asian flu, you have the Hong Kong flu, which are all zoonotic, and then you have the HIV, which has the zoonotic origin, and then you have SARS, you have swine flu, you have MERS, you have Ebola, you have other hemorrhagic diseases, Marburg, and all that. And recently, you have COVID-19, right? And like I said, for the past 3 decades, more and more of these emerging diseases, some of them are completely new, occurred. Starting 1990, you have BSC, you have Hendra, you have Nipah. Nipah occurred in Malaysia, and that's a novel disease. Actually, Hendra and Nipah are both novel disease that occurred as a result of spillover event from bats that goes into the pig population, and Hendra from bats that goes into horses and then to humans, of course. And you have SARS, and then H5N1, which is very interesting and very worrying the way that it is developing currently. You have pandemic H1N1, you have Ebola, Zika, MERS, and COVID has probably killed like 7 million people to current date. So you probably have seen this before as well. So that's why I said when we talk about One Health workforce development, sometimes people relate that to different geography. And a lot of attention on One Health workforce development has been focused on countries or locations in their geography by which is considered as hotspot for emerging diseases. So if you look at where I'm from Malaysia. So Southeast Asia, you see that it's considered as one of the hotspot, and then certain parts of Africa is also considered as another hotspot. But in reality, actually, I think disease can come from anywhere, and pandemic can occur from anywhere as well. Look at what's happening in the US right now with the very worrying trend of avian influenza, the H5N1, and all the researchers and scholars are really following very closely. It's a fascinating type of change, and they are changing so fast and in a very scary way. And then you have the silent pandemic, right? So AMR, this is what is called a silent pandemic. It doesn't really have a very distinctive or like very clear or like unique manifestation. And sometimes it occur in a very subversive way, but definitely is killing many people around the world. In fact, by 2050, this many people around the globe may die because of the AMR. So the next pandemic, people always talk about the next pandemic. What could it be? This pathogen X. What's the next pathogen that potentially could be causing the next pandemic? We just came out of one, so I think there's a level of fatigueness to this, but we cannot relax. We need to continue to be prepared and to make sure that we try to the best we can to reduce the probability of the next pandemic from occurring, which is why there's a lot of conversations right now about the interesting way that H5N1 is changing, right? So it has been able to kill or like to infect many different kinds of mammals now, right? It's killing thousands of seals, sea lions, you know, you see almost anywhere by which just wild birds, and the wild birds possibly died because of avian flu or shed the avian flu virus. You'll see animals being infected, including polar bears, cats, you know, you ask also every day you see news about farms closing and all that. So the evolving behavior and characteristics of AI viruses is of significant global concern and scrutiny. So the rapid evolution causes unpredictable. This is what's scary because it's not predictable and potentially worrying scenario. But you never know. Sometimes when you're paying too much attention on one virus, another virus would sneak in and just suddenly show up, right? So that had happened before. So that's one case that's now in humans that without any known animal exposure. So that's worrying because it suggests human to human transmission. So how is this looming threat unique? This is old, but I think this kind of like give a good overview on why looming threat is unique. It shows you the different factors. If you remember our epidemiological triad, you know, you know that there's always that interaction and the connection between the various elements, and they don't act in vacuum. They all act together, they connect together, and when things are aligned, that's where you get the emerging zoonosis, right? All these different factors. I'm not going to go into them. So those factors are also called drivers. So drivers influences the emergence of zoonotic diseases. These are multifactorial, they connect, they interact, and when they line up, for example, and they may create that ideal situation by which a disease can emerge. So around the world, all these different drivers, there's no like uniform drivers that is important in every single region around the world. So depending on where you are, the drivers that causes disease spillover or pathogen spillover is different. For example, in Malaysia, this is Malaysia. So you see that if you look at the pie chart right here, so you see that land use change, for example, agriculture intensification, and then use of bushmeat. These are the drivers that potentially causes spillover of pathogens into the human population, but it changes with different geographical regions. I just wanted to show you, you know, the One Health spheres very well: animal health, human health, environmental health. So between this, you know, the interface between the two, animal, human, environment, and animal health. So if you look at the different drivers within the domain itself, there are many. And then also when you look at the interface drivers, there are also many, including wildlife farming, trade, and, you know, environmental facts, environmental changes, biodiversity reduction, and then the way that we are producing our animals, and how we are losing our forests. Again, the different type of drivers depends on not just the geographical region, but also the type of pathogens. If it's bacteria, it could be slightly different than if it's virus. So just wanted to show you how complex factors that are contributing to an occurrence of a complex problem is. If you look at AMR, you have so many from the human domains to aquatic, to food, to plants, to environment, to water sanitation and hygiene. So basically this is a wicked problem. So because of the complexity of the problem and pluralistic drivers, it needs a different type of solution, right? So I just want to give you some examples. So you're probably, I'm not sure what major staple meat, or I don't know whether you can call it staple meat. In the US, we love meat here. In Malaysia too, we love meat, right? So because to cater for this demand in meat, so livestock is being reared in an unnatural way, you know, high concentration, very small space. So this to make sure that we can get the protein for cheap, basically. So because of the way the animals are being raised, so you get like pathogens that may be concentrated in certain area and give chance for them to change in terms of their molecular traits and may result in spillover events from wild animals to food animals, from food animals to human. And the fact that they are being transported, increase their stress and all that, result in shedding of those pathogens, which can occur at the market, which can occur at various avenues. Yeah. And then we have also another driver that's very common in my part of the world is then land use change. So there's land use change in Malaysia. It's because of the monocultures, right? Because of this crop-driven economy. And I can't blame anybody for this. It has a lot of colonial history to this. We were never a plantation economy, but because of the colony, we were colonized for like 400 years. Then our economy changed to become plantation economy. And I think Jamaica probably can say the same. So it transformed forests or jungle for anthropogenic reasons. So it resulted in deforestation, defragmentation of natural habitat of wild animals, and it increases people and livestock contact with wild animals and their potential pathogens that could be novel to humans and animals. So we can talk about all the imbalances, predatory-prey relationship and that. What I'm saying here is that this is highly complex issue, and not just that, it results in like degradation of animal habitats. So then it impacted the animal conservation, it causes animal welfare problems, and not just animal welfare problems, but human welfare as well for those individuals or like communities living that are, you know, making use of the forest as their livelihood, like our native or indigenous people. So they are suffering as well because they are losing their forests and their source of food and their source of livelihood. Another driver is wildlife trade and wildlife meat consumption. So this is pretty common in my part of the world just because there's a lot of like trade that's happening. Many of it is illegal. And there's a lot of conversation about how this is driving also the spread of various pathogens across continents. But I feel like when we're talking about wildlife and how people are using wildlife for food in their diet, you can't just like give an umbrella kind of like regulation saying that you cannot consume wild animals, because for some people it's their business, it's their economy, it's their source of major protein. So if you say you can't do it, so what's the alternative, right? Because for SDG, you cannot say that cannot deny people of food and well-being, because then it's just, you know, going to create more disparities and inequalities. So all these different drivers, if you're looking from land use change of animal or like wildlife trade and all the other different drivers, they often fall within the care and jurisdiction of different agencies, different ministries and departments or stakeholders. So traditionally, in most regions, especially true in my part of the world, each of these bodies, they work segmentally or in silo. But you can't really do very much if you were to do that. You can't really talk about One Health issues, which is very complex. It's very cross-sectoral, very cross-cutting when actors are working in segregated manner. That's why
Prof.
you need to be conscious and conscientious about intersectoral collaboration. Are we
Sorry
at
to
30
interrupt, Prof.
minutes?
We have 3 minutes left. Yeah.
Okay, that's fine. So we don't want that, right? So that's why we need pluralistic actions. Okay, I'll skip that. I think everybody knows that. So basically what I'm saying, I think you probably have gotten the major gist of what I'm saying. You need a different sets of workers. I'm just going to show you the resources for enhancing One Health workforce capacity and resilience. And there's many. Um, the tripartite zoonosis guide is very important. It was released in 2020, I think, but many people don't even know it existed. And from there, there's multiple tools such as joint risk assessment operational tools and multi-sectoral coordination mechanism and other tools that's available under WHO. And I wanted to highlight this just in case you are interested. This is a WHO webinar. It's going to happen on the 22nd, developing a dynamic workforce for One Health. So you can register for that, and then there'll be WHO speakers who'll be talking about their tools. So these are some of the tools that's available. So if Jamaica is interested in developing their own workforce capacity beyond what's already there, so that's all these tools. Basically, you don't have to develop them from zero. You can adapt it and adopt it if you wish, as how you like. Another thing, if you are to develop among the university students, the One Health workforce and education, and you don't want to change your curriculum, right? It's hard to do. Changing curriculum is hard to do. So you can have your students enroll in this One Health workforce academies. You can register for this. For now, it's free. So this is under the USAID project, workforce project, and it's being managed by University of California, Davis right now. We have our own for Southeast Asia One Health University Network, and our sister network, Afrohoon, have their own as well. So this kind of like whatever that's there is being tailored to the local context. And we published this. This is quite a good tool if you are interested. It's under Nasim and Engsa. And for this is a guidebook to prevent from spillover. And one of the chapter is a chapter that I wrote with my colleagues. So in there, we talk about the challenges of building a One Health workforce. We went through the 9 key areas of barriers and gaps for implementation of policies related to zoonotic spillover. And then this is the part by which I wrote. We spoke about the challenge such as limited university autonomy. We have ministries that governs everything. Inadequate workforce data. Most parts of our part of the world, we do not have that workforce data, and so the the projection of what you need kind of difficult to do when you don't have adequate data. Workforce structure imbalance, that's really anthropocentric understanding about One Health. So it's very heavy on the human health, but not enough on veterinary health. Limited cross-sectoral training, like I said, this is not natural. So this needs to be some instigation that is cautiously made to make sure that this is happening. Limited workforce capacity and engagement, and then lack of enabling institutional ecosystem. Sometimes people get punished for doing more, especially if they want to work with other sectors. So we are, especially in Malaysia, we don't have enough vets. I'm not sure whether that's true in Jamaica, but it's true in many, many countries. For One Health, you need more vets. Definitely, you need more vets. So in that book also, we included some of the guidelines, actionable guidelines on how to address resource constraints. I just wanted to make a note something about these funding on One Health work right now. Much of the One Health efforts and collaborative efforts and One Health research and One Health workforce development is funded by an external entity. It could be European entities, or it could be United States, or it could be from many parts of the world, mainly rich countries. So for countries that are lower or middle income that are receiving those funds, please remember that you have the power. You have the power to shape the the training, and you have the power to make sure you fulfill the needs of your community. You know, you define what success looks like to you. Okay, the funders have their own agenda, I'm sure, but because you need to maximize this, please make sure that you please insist on fulfilling the needs of your country. Okay, so there is negotiation, I'm sure, that you can do. Please do that. You know, do not just follow, do not just be, you know, receiving this top, whatever, it could be top down, but I think a lot of funders are now better at empowering the local community and co-developing stuff. But if they don't, make sure you voice out your concern, make sure you articulate the necessity of doing that with the local community, with the local workforce. Okay, so just wanted to show you some of the stuff that we have done in Malaysia, trainings for pre-service, academicians, and in-service professionals. We develop a lot of localized modules and guidelines for field level simulation exercises for AI, for rabies, and for AMR, we have our integrated surveillance tools. In Malaysia, we have trained about 10,000 people. So that's the collaborators for One Health with Us project. And I thank you.
Wow, thank you so much. Let's give it up. Look at the emoji. Lots of hearts, lots of claps. Thank you so much, Professor Hassan. Thank you, thank you, thank you for sharing that talk with us. It was very informative. And just so you know, Jamaica also needs more vets. Everywhere needs more vets, as far as I recall. If I look online, every country looking for more vets. So it was very, very informative. I don't want to say anything yet. I'm going to open the floor for questions. We have about 10 minutes for questions. So if anybody has any questions, feel free to put them in the chat. Or Sam, how do we go about questions today? Can you give me a heads up if you're going to be
Sure, Doc.
unmuting next?
So I'll help. We have them in the Q&A here, and the first one is from Adana. When did forgive my pronunciation, Siohon start? How many countries are currently involved, and how many unis are part of it? Need to unmute.
You need to unmute your mic. There you go.
Adana's my girl. I don't know where you are, Adana. Yes, so Sihun started in 2011 formally. We didn't begin work until 2012. So yeah, about 10 years, a decade ago. But the project actually started in 2009, but there was like a lot of issues in terms of like trying to find the right collaborators. So it didn't really start until 2012. Right now, I think we are, I want to say 10 countries, and then there's more than 200 universities that are part of Sihun. Sihun has managed to train as a region about 52,000 people, students, lecturers, ministerial offices, and some private entities as well.
Perfect, thank you. Does your country have a ministry dedicated to One Health research and collaboration?
No, we don't have a ministry dedicated to it. But recently we have developed the One Health strategic action plan that is using the interministerial platform. Even though we don't have a dedicated One Health ministry, we do have this platform for interministerial committee, which is the chairmanship rotated between the ministries. So that ministry will discuss emerging threats like AMR, zoonosis, you know, anything that's emerging. So will be discussed at that platform. Our strategic action plan for One Health is actually very recent. I think it was published last year. Some other countries in Southeast Asia, they have had One Health steering committee at public health ministry or One Health ministry, and at the ministerial level, they some other countries like Vietnam, they have their own One Health dedicated office. We don't for now. I think Indonesia also do not for now.
Okay, thank you so much. This is a loaded one. Where would you say we should start when we're building our workforce capacity? We are currently at 0. We don't have enough vets in Jamaica and lack of cross-sector training. How do we move knowing where we are to, I'm sorry, how do we move from knowing where we are to action? What would you say are the first steps or the most impactful first steps to take?
Very, very good question. It's also a question that we asked when we started off, just because our ministries have been working in silo for decades, right? So I think initially for One Health Project, there was that instigation by the funder to actually reach out to the ministries to try to get them to adopt the One Health effort, but I don't think it went very well. So I would say if you want to start at the university. Start at the university. I think academicians are more adaptable. They're more open-minded. They're more neutral. They are the one who will be training your future workforce. Okay, so they are the one who will be training your future workforce. So you have to change the mindset of your students, and you hope your students will be able to change the mindset of the older generation. So what we are seeing in my part of the world, at least initially, there's the only universities that are interested in this One Health approach. So because of the passion that the ministry saw in our effort in terms of inviting them as resource individuals to give training for One Health training, intersectoral training, communicating that at a public platform, instigating interministerial conversations about tough issues like AMR, antibiotic use across the human health sectors, and what it's doing to the environment. These are tough conversations that sometimes people in the ministries, because of power dynamic and authorities, and also the fear of repercussion, they do not want to speak about those issues. But if you have universities and expertise and respectable scholars or academicians who can connect with the ministries and begin to advocate about One Health, about intersectoral training, about interministerial kind of like effort, slowly it will sink in. It may take a while, but hopefully it will sink in. And then also at the same time, I don't know like how long the ministries can do without, because everywhere in the multilateral agencies, international authoritative agencies like WHO, FAO, WOA, all of them are really emphasizing One Health approach, One Health workforce. So, basically you have to be really sitting in the box, like basically like really covering your eyes and ears to not move in the direction of changing your mindset about working together. So yeah, other than that international push for One Health, if you are starting at the bottom, I definitely go with the university first. Change the mindset of your academicians, change the mindset of your students, and then slowly they will change the mindset of the people in the ministries. I can tell you, like our cousin organization, Afrahun, when they started off, they were having a tough time convincing the people in the ministries and government about how relevant One Health is. And also just because at that time, I think in many countries this is true as well. What's happening in universities is completely independent to what's happening in the ministries, right? Because there's no active conversations about shaping what's needed for the local health sectors or veterinary sectors. There's no interactive conversation or like bidirectional conversation between universities and government. Our counterparts in Africa were having a hard time doing that. But it took a long time, but the government is also changing. And then now there's a lot more cross-sectoral and university government linkages in terms of training and doing capacity building. This capacity building is so important. And now the government is taking more interest into it and working together with AfriHoon to develop the capacity of their own staff, the ministerial offices, the professionals. Any other questions?
Can I just jump in here very quickly because I know we're running out of time. You mentioned this One Health Workforce Academy.
Mhm.
Is this available to anyone? Is there a cost to it? How is it accessed?
Okay.
Because people easily put
So,
this to other universities in the region.
right. One Health Academies is established for free under USAID. And for now, I think all the programs are still free. The modules in there are free. But I think at some point they want to charge, but I'm not sure about charging. But for now, it's free. Yeah. And then we are thinking of giving certificates, but we are still negotiating who will give the certificate. For example, is it going to be the universities? How would it, what type of certificate would be most impactful for the people who actually took the course? So right now there's no certificate of any kind, I don't think, other than completion of the module. But as if you are a lecturer at university, you can just have your students go through the module, make sure they complete it, and then send you the completion of module kind of thing so that they can give evidence that they have completed that training. And also you can use it for your own teaching. The resources there, you can take it for free, and then you can use it for your teaching. If you're thinking about changing how you are teaching your subjects, your course, to include more One Health into it, to make it One Health friendlier, then you can just take whatever that's available there, and then you can adopt it and you adapt it to however you want based on your local scene.
Okay, great. Thank you.
Prof. Hassan, thank you so much.
So-
Doc Leon, that's it. That's all the questions.
Thank you so much. Thank you again, Professor Hassan. One more time for Professor Hassan. And I want to see those emojis. Yes, there they go. There they go for you, Prof. Thank you so much. And I want to turn our attention now to our next presenter. Oh, love, so much love. Wow. I want to turn our attention now to our next presenter, Dr. Raymond Hamoonga, who is in Zambia. Okay, wow. Thank you so much for coming to our conference. And let me just tell you a little bit about Dr. Raymond Hamoonga. He's a veterinarian and a One Health specialist at the Africa CDC Regional Investment Financing Project, Zambia. He is a result-driven epidemiologist with over 10 years of experience with skills in One Health, multi-sectoral and transdisciplinary collaboration, working at the local, regional, national, and global levels. His background includes researching disease management procedures to enhance field knowledge and business success, developing, customizing, and strengthening applications to achieve challenging objectives with the help of innovative, analytical, and computational strategies. He holds a master's degree in epidemiology from Massey University, New Zealand, and a Bachelor of Veterinary Medicine from the University of Zambia. Please help me welcome from halfway across the world, from me at the very least, Dr. Raymond Hamoonga. Don't move from the emoji buttons. You have to, there we go. Dr. Hamoonga, it is your time.
Thank you so much, Kathy, for the introduction, and thank you indeed for having me present at this very wonderful conference. Already very insightful presentation there from Prof. I was learning quite a lot myself as well. Let me just share my screen now. Great, thank you. I'm going to share our experience as Zambia in the process that we are in, trying to establish a One Health program for the nation, a national One Health program. And this is work in progress, and I believe that the more we share about it, the more we learn and also hear of others' experiences. I would like to share the mistakes we've gone through, and hopefully that you may not make the same mistakes as well, and also learn from your best practices as well. So obviously, the issue around One Health stems from the fact that we live in a world that is highly interconnected, and the threats that we are encountering right now require cross-sectional and system-wide approaches. And basically, this is what is encapsulated in the One Health concept, being collaborative, multidisciplinary, multi-sectoral approach to address what is actually ongoing. Beyond that, it's also very helpful for us to apply a One Health approach because of how cost effective that turns out. We learn from your mistakes in the past, you move away from silos, and you can only do that by understanding the factors that determine and influence these threats that we are faced with. I like starting off with this slide. The definition of One Health. This is the definition that the One Health high-level expert give us for One Health. And it says, it's quite a mouthful, an integrated unifying approach that aims to sustainably balance and optimize the health of peoples, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. And the approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems while addressing the collective need for clean water, energy, air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. I deliberately took time to read out every word on this slide because when you say One Health, this is the mandate that you expected to cover. And so in the next few slides, I'll go over what we prioritize as One Health in the context of Zambia. Because when we talk about One Health, we are expected to cover all these aspects of One Health. Now, let's start with the status of implementation. So in Zambia, until 2020, we didn't have any One Health legislature in the country. And the closest that we got to having a One Health legislation was the passing of this Act number 20, the Zambia National Public Health Institute Act of number 19 of 2020, which established the National Public Health Institute, which essentially is like our country's CDC, the US CDC or UKHSA, if that's what you are familiar with, or the European CDC. This is our own Zambian CDC. So it was charged to enhance and safeguard public health security. And in there, we deliberately purposed to put line ministries that we know are tasked with public health security. You can see there that we do have the ministry responsible for health, the ministry responsible for animal health, the ministry responsible for water and sanitation, and all those other line ministries. These are the ones that serve as the overall overseeing body of the institute, because public health is a public good and does belong to one sector or ministry. And then in the functions of the institute, among the many functions, function number H, right at the bottom there, speaks about how the institute was tasked is tasked rather to support and manage an integrated One Health information platform in order to achieve a One Health approach to public health security. So this is the first time that in our legislation, we had the term One Health explicitly set out. Now with the act in place, it was time to make things rolling. Step one, we had to hold a stakeholder meeting to determine what would be the priorities for One Health approach in the country. Like I said earlier on, One Health is such a broad theme. We needed to decide if we're going to have One Health, what should be our priority as a country from the many things that we are faced with. And having had this meeting, stakeholders meeting, we prioritized and zoomed in to 5 priorities, which I'll speak to very shortly. But with those 5 priorities, it meant we needed to draft that into a document. And that's what birthed what is known as our National One Health Strategic Plan, 2022 to 2026. So to the left, you can see the picture of the drafting meeting. And also to the right, that's the actual strategic plan that was drafted and waiting for our government leadership to launch. Now, this was very important because it meant we had to gain consensus from various line ministries who would be able to say, yes, indeed, this represents what One Health is going to look like for us and in our context. So the 5 thematic areas that our strategic plan covers, we zoomed on those ones: governance and coordination, to have a functional and well-coordinated One Health national program; preparedness and response; advocacy, communication and training; research; and One Health surveillance. We determined that these 5 thematic areas would really be the ones that would drive the One Health agenda in the country for this given time period. And before we could launch it, we wanted to find a way of validating what we thought we had agreed on. And almost always, One Health, Ministry of Health, or rather the human health sector, public health, and the animal health sector tend to play quite a critical role. I think it's because of the way we are very structured. I think everybody understands health, and then the environment tends to lag behind on most times, but we try to bring them on board. So to validate our program, we reached out to the quadripartite and organized a bridging workshop, the IHRA PVS National Bridging Workshop. So this is a workshop that brings together the public health sector, which is international health regulation tools, and the performance of veterinary services too, and you bridge that to come up with what is known as a roadmap. So to the left, you have the DG for the Public Health Institute. To the right, you have the Director General for the Veterinary Services. And we had all those people in attendance from the human, animal, and the environment sector, that being the wildlife guys, the ecologists, the people from the mining area, to accommodate change in land use and all those things, as well as agriculture. So having done that, we had that roadmap. That's just a snippet of the roadmap where we had key issues that this bigger group identified, and now we could compare and say, are the issues raised here being addressed by our national strategic plan? So armed with that validation, we were able to define our coordinating levels at 3 levels. The highest level of coordination is the One Health Steering Committee, and this comprises permanent secretaries. So the permanent secretary is the highest civil servant in a government ministry in Zambia. They deputize the actual minister themselves. So we have the permanent secretaries of some of the key strategic line ministries as highlighted there, and then we also have a number of cooperating partners that are co-opted into there, like the WHO, FAO, UNEP, WOA, the World Bank, Africa CDC, US CDC, and so on and so forth. Then below that level of coordination, we have more or less the same ministries, but now at director level. They serve in the One Health Coordinating Committee, which is the second tier of coordination. And then below that, we have our One Health technical working groups. So these ones are aligned to the 5 thematic areas I highlighted earlier on. That is the governance and coordination, surveillance, preparedness and response, research and advocacy communication, and training. So with that, it is very important for any program of this matter to go on that we garner and bring in on board government leadership. So for that, we had a launch of the strategic plan. The top left corner there was a meeting that met to draft the terms of references for these 5 technical working groups, because that's where we really operationalize the One Health itself. And then the other 2 pictures are just the VIP that came to attend. We made sure we brought in the quadripartite, the leaders of WHO, FAO, and UNEP in the country. We had representation of also ambassadors from various missions in the country, as well as government itself was there. And importantly, the strategic plan itself was co-signed by the permanent secretaries of the main 3-line ministries, because this document is not a one-sector document. It represents the collective effort that the 3-line ministries who are taking lead would say we commit to putting this into policy. So away from that, just to highlight what is really found in those 5 thematic areas, starting with governance and coordination, we seek to review the legislation to ensure that our laws can accommodate One Health. For a long time, most of our laws were crafted to be sector-specific.
Check 1, 2.
Yes, hello.
Doc, you're hearing me?
I'm hearing you. Are you hearing me?
I am. I think Dr. Hamoonga may have
Yes,
had
he's hearing
some
you.
internet outage. Let's see if he gets Let's see if he gets reconnected really quickly. Sorry, everybody. Dr. Hamoonga probably just having a little bit of internet or electricity issues. Yeah, he's gone. He should join us really soonly. But again, we thank you all for being here. And in the meantime, we're going to ask you to watch this video overview about One Health until I can get Dr. Hamoonga back. All right, so stick with us. Technology. We'll be right back.
I'm Dr. Paul Cadogan. I'm a veterinarian, and today I'd like to talk to you for a few minutes about One Health and why it's so important to all of us. Okay, so we're going to get into the presentation. One Health, a 5-minute tutorial, hopefully. All right, so the definition of One Health, the official one of the official definitions coming out of the One Health Commission is a collaborative effort of health science professions together with their related disciplines and institutions working locally, nationally, and globally to obtain optimal health for people, domestic animals, wildlife, plants, and the environment. So that means everything is interrelated. It means that all the persons who work in the various disciplines, from the doctors for people, doctors for animals, all their related professions, environmental professionals, biologists, agricultural people, social scientists, researchers, and all of those in both the government and private sector need to work together for better health, for a better world, because it's all interrelated. The One Health triad over here, healthy people, healthy animals, healthy environments, will lead to a healthier world. So, what are some of the areas that benefit from this One Health collaborative approach? Here are some. Infectious diseases, those diseases that pass between people and animals, animals to people, people to animals, zoonotic or anthroponotic as we call them. We know about coronavirus, we know about the flu viruses and the bacterial infections like E. coli and leptospirosis and Staphylococcus, the one that infects your skin and can eat your flesh if it's MRSA. You have the diseases that are transmitted by mosquitoes and ticks and other parasites. We call those the vector-borne diseases. We have other infectious disease, we know one, and nasty one called rabies, which we're fortunate not to have in Jamaica. But all these benefit from that One Health approach because it's not.
All right, everybody. I think we have Dr. Hamoonga back with us. Doc, are you okay? You there?
Yes. Apologies, I had a network blip.
No,
Apologies, I
no
had a
problem
network
at
blip.
all.
Yes.
No problem
Okay.
at
Yes.
all. No problem at all.
Okay.
Thank you so much for rejoining. So, I was about to take a screenshot of the slide you were on, but if you could just reshare, we have 15 minutes left in your presentation. We're doing one foot. Yeah, this is where we were. One Health surveillance.
Okay.
So back over to you.
Yes.
Thank you so much.
Thank you. And yep. Okay. So under One Health surveillance, the priority is really to enhance the surveillance of key public health issues, especially zoonotic diseases. And then under preparedness and response, the key issue is to strengthen capacity for preparedness to respond to zoonotic disease and public health events, and also strengthen the coordination of emergency preparedness and response to public health events. That one also now highlights what is our key priorities under the advocacy, communication, and training. And this is where we've put even issues around risk communication and community engagements. It's really the advocate wing of the TWGs. And of course, by research, we hope we can drive the research agenda and ensure that there's collaborative research, which is aligned to One Health, at least by 75%. Now, to start somewhere, we needed to have common keys and objectives that would want to bring us together. And key to that was the issue around prioritizing zoonotic diseases for multi-sectoral One Health collaboration in Zambia. We adapted the USCDC prioritization tool to determine what would be the top 10 priority zoonotic conditions for the country. And I just like Prof in the previous session said, prioritizing what is locally important is just what has been key for our journey so far. So that if anybody comes, we can say these are the national priorities with respect to zoonotic diseases. And these are the priorities with respect to One Health. So having done that workshop, we came up with these priority zoonotic conditions. Those are the 10 priority zoonotic conditions for Zambia. And we employed, again, as highlighted already, the Joint Risk Assessment tool of WHO. And that just shows the pictures that we had to prioritize to conduct the Joint Risk Assessment. And as of today, we've done joint risk assessment for 6 of the 10 priority zoonotic conditions. So that means we've got a straight roadmap, an agreement of who does what in the event that we have an anthrax or African trips or rabies outbreak. And I'll also going to speak a little bit about some of a few case examples of how we've been employing this in practice. Number one is anthrax. Last year, we had a big anthrax case, and the map here is of Zambia and shows you the districts. We have got 116 districts in the country, and those are the districts that we are reporting animal anthrax cases. But interestingly, you find that the human cases were spread in that manner. Basically, the rest of the country was in anthrax. And that speaks to how connected most of these things are, because we found that due to the travel bans and animal sale of meat that were imposed, people started trading in this anthrax meat illegally and taking it beyond the district that we are reporting anthrax. Another case that we can speak to is the after-action reviews that we continuously hold in a multi-sectoral way. So this one specifically was addressing the anthrax outbreak. Once it had been closed, we held an after-action review to see how these things that we had put in place actually worked or did not work well. Another case that we had that was of One Health in nature was around aflatoxin toxicity. So brief background to this, there was detected high levels of aflatoxin in selected maize meal and animal feed products. We lost, especially in urban areas where we could count, over 100 dogs due to suspected aflatoxin contamination of their feed. Now, that did serve as a sentinel or a warning for public health as well, because the millers that produce dog pellets also produce the maize meal and other maize products that are consumed by humans. And certainly once we went into the field, we found that the levels of aflatoxin in the maize, which is our staple food, was very, very high. And using a One Health approach, we had various government ministries and agencies coming into play to see what they could bring to the table, as highlighted there, the Ministry of Agriculture, Health, our Bureau of Standards, Compulsory Standards, the university itself, and also the other line ministries, the Food Commission. All these were working in an unprecedented One Health approach and being coordinated by the Institute to ensure that we could put in place strict control measures. So we had seizure notices, product recalls, public destruction, and extended sampling and surveillance. So away from that, I wanted to address the issue of One Health funding. Because of having our strategic plan that is endorsed by all the line ministries and also a clear roadmap of what we feel we need to do as a country in the space of One Health, we were successful and able to apply for funding. In the first round of pandemic funding, we were awarded 19 USD million as a country. And this goes towards those highlighted areas for IPC, RCCE, capacities related to zoonotic disease, and also health emergency management. And we feel these are things that they are easy wins that you can get into once you have this strategic plan in place, your priorities are set right, and you know you've got that consensus from other ministries. We've also joined the Nature for Health Multi-Partner Trust Fund. I think they do make calls every year. This is another funding that has really is earmarked to strengthen us to bring the environment on board. There's so much funding that is related around animal and public health, but our colleagues in the environment space also need to come on board. So we are looking at seeing how we can incorporate issues around extreme weather events. What impact do those events have? Climate change. We've seen the emergency of things like diseases like anthrax in our country occurring in districts that had previously never recorded. And this is all because of the environment issues that are coming on board. Also, working collaboratively has also helped to attain some of the key international health regulation needs, such as the National Action Plan for Health Security, which is a document that as member states, we are mandated to come together and address how we are going to strategize around issues of public health security in the country. So up there on the screen just shows a snippet of the Zambian NAFS document where we look at issues around legal instruments, gender equity, multi-sector coordination of antimicrobial resistance, and so on and so forth. So all these again are driven by the One Health agenda and where we are at. Of course, it has not been an all rosy journey. I'll share a few of the challenges that we are experiencing. As a country, despite us having some kind of legislature, the coordination aspect is something that we are trying to work out. We are experimenting and reading into various models. There's an issue of putting your coordination office in the office of the Prime Minister or the Vice President. We want to see how that can work in our context. The Secretariat, which is the institute, still in its infancy. And also, while we've done a lot of work at national level, when we go to sub-national levels, we are yet to do a lot of work, and that's the focus for 2025. We want to focus largely on sub-national structures, establishing coordination mechanisms. Like I highlighted earlier on, much of the legislation and regulations are quite old, outdated, and sometimes obsolete. And also the issue of staff resources and education. A lot of our curricula is yet really being to incorporate One Health. And also where One Health courses are being offered, there's no direct or there's no automatic linkage between what the universities are channeling and what these people go and do in the actual industry. Lab capacity, and also I think from the COVID experience, we realized that our diagnostic capacity is quite limited, and also shipment of these biological samples. Most of our labs, our clinical laboratories, are not designed to handle public health security samples. So to conclude, we are still working at establishing the coordination platform. For the technical working groups, we've at least been able to get nomination of members from all line ministries. There's still need for us to increase multi-sector collaboration. And with the help of our cooperating partners, now we are recruiting staff that will sit in line ministries to coordinate One Health desk and take it outside the public health space alone, but to have people sitting in the Ministry of Mines, in the Ministry of Green Economy and Environment, who are going to coordinate One Health, and then we just play a secretarial role. I've put in the link there for our One Health strategic plan. You can look into it. We learned from others. We didn't have to reinvent when we were drafting ours, but one thing that we've agreed is to ensure that the priorities in the plan are what drives the One Health agenda. Thank you so much for having me, and that's where I end my presentation. Over to you, Chair.
Thank you, thank you, thank you, Dr. Hamoonga. Even amidst the challenges, you were able to pull through and be back on our presentation, on our webinar, and look at all the love coming in, cheers, claps, thumbs up. It was an excellent presentation, lots of comments coming in. Dr. May saying excellent presentation. Thank you, all kinds of thank yous coming in the chat. Thank you so much. And we're going to open the floor now for questions. I like when Sam reads the questions because I don't like to hear my own voice. So I'm going to leave it to Sam to do the questions and the Q&A section. Please, our audience, please remember to type your questions and even your comments in the Q&A section. Okay, Sam, you know what? I'll do the first one. I'm looking at a question here from, I think it's Caroline Mary Sloper. She says, how is One Health putting pressure on agribusinesses to ban indiscriminate use of antibiotics in intensive farming practices? Dr. Hamoonga, that's for you. Are you there?
Yes, thank you. So that's a great question, and I think resource constraints setting that we are in, and the same question applies to antimicrobial resistance as well. So we have regulation, and then we are also in areas where truly the agribusinesses are what the farmers are at the mercy of. So we've engaged and started doing a lot of stewardship programs, antimicrobial stewardship programs, and also the issue of just bringing into all the agribusinesses using legislature to ensure that they're operating within the confines of the law. So it's really a give and take situation. We are trying to get to a point where you can enforce, but at the same time, be alive to the fact that in most of the areas, we haven't yet provided enough service as technocrats to allow for agribusiness to be working strictly under the confines of the law. Over.
Right. Thank you so much for that. All right. So I see another question here from Maxine Cargill. Great presentation, Dr. Hamoonga. I believe aflatoxins can affect peanuts too. How do small farmers / peanut vendors prevent these fungi from affecting peanuts? Do you know the answer to that question?
Yeah, so what the issue of aflatoxin actually showed us was that one, we were disjointed. There are a lot of programs that have been funded by, for instance, USAID on managing aflatoxin, USAID, GIZ, in specific crops, like you rightly pointed out. We've got a document that speaks to aflatoxin management in peanuts, a document that speaks to aflatoxin in maize, but we do not have one strategic plan on the management of aflatoxin across the whole value chain. Because remember, some of the maize we use is imported, but there's no strategic plan that says, when this maize is in transit, how do you take care of it? When it goes to the production areas, and that goes for all these crops, peanuts as well, what happens? And so following this large aflatoxin outbreak, we've constituted a TWG of team of experts, and we are trying to draft now a national aflatoxin control strategy that will speak across all the value chain and across all plants as well. So this is work in progress, but most of the small-scale farmers, at least that are linked to cooperatives, have received that support from our cooperating partners and government on how they can manage aflatoxin.
Wow. Wow. Awesome. All right. So we have another question from Marcus Nash. Hi, Doctor. Going forward in Zambia, do you believe a single government ministry with the relevant areas in it will be formed coming out of these roadmaps?
So I wish I had taken a picture of the definition of that One Health workforce. I really liked it, where it says, I think One Health is about us being united in being diverse. So we don't believe that we want to come with one single ministry that will channel all these activities, but we want the current existing ministries to talk more to each other, where you stay as a sector, but you need to be considerate of your activities, how they impact other sectors. We know that mining is quite big in Zambia, but it has a huge impact on land use and also agriculture as well. So how can these line ministries be able to come to the table and say, what is a priority in the space of in the context of public health security? So we don't want to have one just ministry, but have rather these ministries beginning to speak to each other and see the relevance and how they all play out to the health of the well-being of Zambians.
Awesome. All right. Thank you so much. Okay, so I'm not sure I can pronounce this name. Theogene. And then the last name,
Nizeyama.
Imana. Nizeyimana.
Mhm.
How One Health program has been applied to save bees from agriculture, pesticide, and aquatic biodiversity from chemical fertilizers.
Excellent. So the issue of bees falls for us under the ministry responsible for animal health. And so the fact that we've gotten our colleagues on board, we do have a quite a well-developed bee industry, because they're able to export into Europe. And I think that's one of the area that even was one of the pioneers around using a One Health approach to ensure food safety and limit the use of pesticides in the production of the honey that exported, because they export largely organic honey, and therefore they've got stringent measures that they employ in safeguarding the health of bees, the bee farming itself, and limiting the use of pesticides.
Okay. And then we have one more question from Paul Brown, who asks, how well is Zambia doing with wash issues? That has been a major issue with most African countries, which hampers most health efforts. That's the water, sanitation, and hygiene issues. That's what he means by wash issues.
Great, yes. So as Zambia, like I said, we actually came out of a big cholera outbreak. We had a large cholera outbreak, and so when it comes to issues of wash, I think it has also been two things. One, it has made is no matter how bad it is, but it has made a case for us as One Health because issues of wash sit outside the Ministry of Health. And so every time we get an outbreak, people turn to the ministry, but we said, look, it has to be all the other sectors working together. The provision of clean water is a mandate of another ministry, not the Ministry of Health. The issue of sanitation is for the local authorities that are responsible for ensuring that the drainages in the cities are cleaned. The issue of unplanned settlements, which have really been the driver of diarrheal diseases and other related wash matters, again, it sits under the local authorities. So we've been trying to see how we can bring everybody on board. And you may be aware that Zambia sponsored the resolution at the United Nations to end cholera by 2030 in the world. And so the issue of wash have taken center stage, and people are being brought together using a One Health approach to ensure that everybody plays their active role. So we're still work in progress, but it's something that we are working at. Thank you.
Awesome. Thank you. Thank you. Thank you so much, Dr. Hamoonga. There are no more questions. So of course, we're going to be seeing all the love coming out now in the emojis and in the chat. Lots of people have said it was an excellent presentation. And I see that Prof. Hassan says she has to go. So bye, Prof. Hassan. Thank you so much. And I believe Dr. Hamoonga will also be going because it's nighttime there and probably going to go to his bed. And I don't blame him because it's daytime here and I want to go to my bed. So
No, thank you so much, and thank you for the love and support. Yeah, it's just before midnight over here. Thanks a lot.
wow, wow. Well, thank you so much for being here. I mean, that is commitment. So my emoji is 2 thumbs up. It's 2. Thank you so much for being here, and thank you for your wealth of knowledge. That information that you gave us was so amazing, and I love what's happening in Zambia, and I hope we can follow suit really, really soon. So please have a wonderful sleep. Don't dream about us. Dream good things.
Thank you very much. Thank you.
All right. So see, a lot of people, sweet dreams, Prof. Well done. Thank you, doctor. All right. Good night and good night, Dr. Hamoonga. So before we get to our next presenter, we're going to have a sponsorship presentation. So I'm going to turn over to Sam, who's going to turn over to our sponsor.
Thank you so much, Doc. So our next presenter is Baruch Distributors. Is the rep here? Let me see if I see.
I see Vanessa is on.
Yes, I'm on.
Hi, Vanessa.
Hi there.
Please go ahead. You should be able to share screen and go ahead.
Good evening, or we're all over the world. So good afternoon, good morning, good night. Hi, good everyone. I'm Vanessa Chatry. I'm owner and managing director of Baruch Distributors Limited. And as such, it's a privilege and an honor to be here today as a sponsor. Right. So first of all, I will say kudos to JVMA and also the Caribbean College of the Family Physician putting this critical event on board, which I think is very timely and something that we are proud to be a part of. So in the light of time, we'll just go through what we do. So Baruch Distributors Limited, our vision statement is to be the most accessible and responsive animal healthcare company in the Caribbean, where our customer lives are enriched through maximizing on their investment while promoting a One Health approach mindset. Right? So our mission is that really and truly we are a regional company with an exclusive line of generic animal healthcare pharmaceutical with a goal of accomplishing or achieving food sustainability and promoting a One Health approach for today's generation and also generation to come. We at Baruch, we're fully committed to supporting and high quality, innovative, cost-effective products, providing solution from cutting-edge technology in animal health care equipment as well for agriculture, livestock, poultry, companion animal, and horses, right? We strive to assist both small and large farmers, pet owners, veterinarians that will inevitably drive the economic growth and food security, along with excellent customer service, warmth, and compassion. Our business is focused on incredible role we can play through connecting to healthier people, healthier animals, a healthier planet, while establishing food security, not only for Jamaica, but for the Caribbean. And this is our catalog of the products that we bring. So we're a small company, we're just 5 years old. But even though we're 5 years old, we have accomplished a lot, right? So this is our basic catalog in which we have herbal products, we have natural herbal products, which I'm very proud of. And I heard that question that was shared not too long ago, and I'll go a little bit into that. It's just 5 minutes, so I'm going to be very fast, right? We have nutritional products, disinfectant, salt block, antibiotic powder, injectable, a multivitamin injectable, and dewormers, right? In light of the fact that we all know that we're moving away from the usage of antibiotics, right? Baruch is we are proud to incorporate herbal product in Jamaica, in which we have introduced 2 lines of herbal products, namely the Garvital and the Coxsacin. And we have proven that these products have been very efficiently, they have been effective, I'm sorry. Of course, you guys will know that they are safe. So we have been doing trials, we have been using these products for about 3 years, and it has somewhat reduced and sometimes completely eliminated the usage of antibiotics. So this is just some of the accomplishment that Baruch has accomplished in Jamaica economy, and we will also like to extend it to the world. So Coxsacin and Garvital, this is one of our premier products. And Coxsacin is a combination of our herbal products. So the organ oil, the thyme oil, the garlic, sage oil, and rosemary. And this product has been proven to be safely and efficiently prevent cocci and also other related intestinal problems. Another one that we introduce is the Garvital, which is garlic oil, along with echinacea and vitamin B1 and B6. So, and also we have small animal line products such as Patron, which is a generic for Advantage 2, which is to kill mosquitoes, fleas, and ticks on animals. So this is our contact details. Baruch Distributors Limited. We're located in Bob Walk, St. Catherine. Our email address is baruchanimalhealth@outlook.com or baruchdistributors@outlook.com. Telephone number, call or WhatsApp, 876-531-9635. And also you can follow us on Instagram and Facebook. Right, so that will be my 5 minutes. If there are any questions, I'll be honored to answer. And thanks for inviting us. It's indeed a pleasure to be here and to share with you. And I believe that we're in this together to provide a healthier nation for not just for us, but our generations to come. Thank you.
Thank you so much. Thank you to Baruch Distributors. Dr. Leon, back to you.
All right, thank you. Thank you, Vanessa. That's some good products. I think we have space for maybe 1 or 2 questions, if you have any for Vanessa, based on the timestamp. So if there's anyone who has a question, feel free to type it in the Q&A now. See, Vanessa, lots of love going up for you. Go ahead, Dr. Cadogan.
Yeah, what species are those herbal products for? Is it specifically for poultry or other animal species too?
Namely for poultry and pig, swine.
Okay.
To work better in the districts.
Seeing a lot of
All right.
love, but not a lot of questions. All right. Well, hopefully persons should have just taken a
Lots of
screenshot
questions. So
of
lots of love
the
for you,
contact.
Vanessa. Sure. If you don't mind, Vanessa, well, can you put that up again or
Well, here's a question.
Like to put that in the chat, Vanessa, so that contact you. Are the products for dogs, is it if you're asking if they're at JSPCA? The products for dogs, at JSPCA, Tonette Grandison is asking. Vanessa?
I'm sorry, what was the question? If the product patron is at JSPCA?
I'm not sure which product
Which
Ms.
product
Grandison is
is it
referring to, but
talking?
do you have any product at JSPCA?
What happened is that we're a distributing company. So we distribute through Hypro, namely through Hypro and Nutramix and small farm stores. So Hypro, they distribute to JSPCA. So our line of product will be available to JSPCA through Hypro or through Nutramix that they purchase from. And they do Hypro do sell these products. So I'll assume that they do have it. If not, you can contact us or Hypro or Nutramix.
All right. Okay, so thank you, Vanessa. There are the numbers on your screen again. And I just want to allow that to stay up while I speak about our next presenter. And move right along. So our next presenter is Mrs. Sherine Huntley-Jones. And she is an esteemed medical entomologist and the program director for the Ministry of Health and Wellness Vector Control Program in Jamaica, where she has dedicated over 25 years to advancing public health initiatives. Her extensive experience encompasses the development and implementation of policies aimed at controlling vector-borne diseases. Aha. Currently, Mrs. Huntley-Jones serves as one of the focal points for the Sterile Insect Technique project in Jamaica, exploring innovative applications of this method as part of an integrated vector management strategy. Her work not only contributes to the ongoing efforts to mitigate the impact of pests and disease vectors, but also positions Jamaica at the forefront of pioneering entomological research and sustainable public health practices. In addition to her role at the ministry, she is a part-time lecturer at the University of the West Indies, where she shares her wealth of knowledge and expertise with the next generation of health professionals. Her commitment to education, research, and community health underscores her dedication to creating a healthier future for all. She is recognized for her leadership, collaborative spirit, and passion for advancing vector control measures, making her a respected figure in the field of medical entomology. She continues to inspire her colleagues and students alike, driving innovative solutions to public health challenges in Jamaica and beyond. So Mrs. Sherine Huntley-Jones is here to present to us Vector Control in Jamaica, the Sterile Insect Technique for Mosquito Control. Praise the Lord, let us control these mosquitoes. And welcome, Mrs. Sherine Huntley-Jones. Emojis going.
Thank you so much. Mrs. Huntley-Jones is not with us just yet. Unfortunately, she may be having some technical issues. I'll try to reach out to her. I'm asking that we move to our next presenter in the meantime.
After I read all of that,
Well, it's awesome. You were doing so well. So I'll be able to just edit all of that. So when she get here, it's like you don't even have to introduce her again. Yeah.
all right, you're going to replay that?
Yeah, I'm gonna replay it.
Okay. So
All
then
right.
let's thank her for her spirit and move on to the next presenter who's going to be presenting in our mental health section of our program. So the topic is going to be emotional support, service and emotional support animals, their uses and abuses. And our presenter is Dr. Lesley Robson. Now, she was born and raised in Jamaica, But since she don't live here no more, I wonder if I need to do this presentation with a twang. Dr. Robson, I must twang. If you laugh, I go, she's laughing. So that means I have to do it in my accent. It's not an accent, it's an accident. Dr. Lesley Robson is a veterinarian born and raised in Jamaica. Wait, she in Florida or she in California? Can't do the California accent. Okay, good. Raised in Jamaica. Her interest in veterinary medicine started early as a young child in the cool hills of Manchester and culminated in her graduation from the University of Florida College of Veterinary Medicine in 1991. She went on to be certified in rehabilitation and sports medicine in 2008. After being a general practitioner, working initially in a large mixed animal practice, but now working primarily with small animals and exotics. I got that right. That was exotics, not how we say it in Jamaica, exotics. She currently owns rehabilitation and sports medicine services in Gainesville, Florida, and is also pursuing coursework in veterinary forensics. She does voluntary work in her spare time and has worked with pet care agencies offering free services for the pets of the homeless, Operation Catnip, a spay and neuter vaccinate program for free-ranging cats, the Humane Society of the US, and currently with the JSPCA and Spay Neuter Jamaica. She pursues these passions in the belief that there is community health through animal health and welfare, and that the intuitive and empathic nature of animals can truly be healing. She has worked alongside her service dog, Maggie, for 10 years. Please help me to welcome Dr. Lesley Robson. I hope I didn't make this a joke. I'm actually really, really excited to hear from her. And she really has a good heart and believes in animal health and welfare and the use of service dogs. So help me welcome Dr. Robson. Thank you so much for being here. Let me stop now. Come on in, Dr. Robson. You have to unmute.
There you go. So thank you very much for that introduction. And can you hear me now? I should ask.
Yes, we can.
Okay, very good. So I hope everybody is awake and enjoying the talks. I certainly am. I'm learning new things all the time. And I guess I will get up my presentation and I'll get it back to the beginning, as I am not very prepared right now. There you go. So I was asked to give this talk, and over the years, having a service dog, I've gotten a lot of questions about them. Maggie is since retired and I no longer need her services. But I got a lot of questions and there's a lot of confusion, even here in the United States. I've gotten confusion. I've had people ask me, even in the Ministry of Health and Ministry of Fisheries, about these animals and what their training is, what they do, how are you supposed to regulate them, how do you know they're true service animals, these kinds of things. So I thought I would address that topic, as there's somebody coming behind me that is also going to talk about the benefit of animals in human health. So I'm a firm believer of animals in health. Animals have been working with us since dinosaurs were walking the earth and we came around. Dogs would circle around campfires and have developed a symbiotic relationship with people. And it has just grown from there. So on we go. What are they? People don't know.
Doc, we need you to share your screen.
Am I not sharing my screen?
Not yet, no.
Oh, I did hit that button, you know. Let me get back out here.
I'm sorry. Thank you so much.
Oh, no worries. Thank you for the heads up. I have to get back to the other. I've lost my share my screen button.
Yeah, so we need you to come back to Zoom.
I have. I just got back there and I see share my screen.
Perfect.
I'm not tapping my buttons hard enough, apparently.
I'm sorry.
Okay, there we go. Now I
No,
need
it's
to
not
do-
sharing yet.
Not sharing yet. I'm
No.
hitting the button and nothing is happening.
So when you click on share, you should see a pop-up, and
Yep.
then it should say screens, documents, or advanced.
I see what you're saying.
Then you need to click on screens. Looks like you're sharing now.
I'm sharing.
Perfect. So then we just need you to go to PowerPoint.
I have to get this Zoom thing off. I have a sign in for Zoom for my Zoom is set up a little differently for work.
That's sure.
It's not letting me, it wants me to leave the webinar, so I won't do that.
No,
There we go.
you should
Can
be
you
able
see
to that right, and then we
There
just
you
go
go.
into from the beginning.
There we go.
There we are.
Got it now. My apologies. So the biggest problem is, what are they? And I've had lots of questions over the years from different groups. Are they service animals? Are they working animals? Are they therapy animals? Or are they their own entity? And so what I'm doing from here is, they are not service animals. So service animals are allowed the greatest general public access available for working animals. They work with their people to mitigate their disabilities. The jackets they wear, a lot of people don't realize, mean something. So blue jacketed dogs are usually mobility dogs. Red is medic alert. Neurologic, or like a seizure response dog, or psychiatric, like severe PTSD patients. Either will wear because there's so many military in this department, they wear a camouflage jacket. Neurologic is distinctly purple. And autism dogs, which are coming on screen online more and more, because children with severe autism tend to run and hide. And if you're a busy mom, and all of a sudden you're missing your child, you can send out your border collie, go find it. And it often has a handle that the kids are trained with, that they see the dog, they see the handle, they grab a hold of it, and the dog takes it back to mom. If the kid won't come, the dog will go find mom and bring mom to the kid. So I've seen one of these at work in an airport. Somebody was very offended. There was a dog running rampantly through the airport, and I pointed out to her that it was actually working and to leave it alone and not call the police. So, oh no, cats are helping. So they require a minimum of 2 to 3 years of specialized training on top of general obedience training, and they must be orthopedically sound and free of all physical defects. And they must have exams every year that involve hearing checks and sight tests because of their work they do. They are viewed as durable medical equipment. They are not pets. Now, they do have a side service to the people they work with where they do offer emotional support, but that is not their main directive. They're not working dogs. We've all seen these. The police are in black, military dogs are in camo, search and rescue are in orange. We have animal tracking dogs, which in the United States, they're now training dogs to track different species of animals that are elusive. Like here in the States, they've trained a bunch of dogs to find wolverines, which are very secretive and you hardly ever seen them. So they know where they're going to show up, so they can actually test some of these animals for zoonotic diseases and things like that. They also, we have one dog that does, we have one dog that also does turtle research. He finds turtle nests before other people do, and so they can be tagged and monitored for safety. We've all met, if you've flown, these USDA beagles. They're looking for the patties in your luggage. You know, they have their job. And then also livestock guardian dogs also work. And I actually am very interested in seeing these guys starting to work with people in Jamaica to cut down on the number of abuse of people's pets with poisoning, to hopefully mitigate some of that. They are allowed general access only when required to do their work. So if the police coming into your house, they have access to your house. So they also, if you have a military dog going onto a base, or the search and rescue animals going to like a 9/11 type situation. They also have 2 to 4 years of specialized training on top of general obedience. They are not pets. All of these 2 top tiers usually cost between $20,000 and $40,000 to train and receive these animals. And that is out of a lot of people's pockets. And this will become important later on when I discuss that you can train your own animals. And this has its problems, I should say. They're also not therapy animals. And this is one of the biggest confusions I see, because people think therapy animals are ESA animals, and they're not. Therapy animals belong to a group. They visit nursing homes, hospitals. In fact, in Jamaica, we have Dr. Teddy, who goes and visits children at the Children's Hospital. We also have, they visit areas of intense emotional trauma, school shootings being one. We've also have them visit 9/11 to even support the animals that were working on the big pile that was there. And they also went and helped all the people that were also working on that debris pile for years. They are allowed partial access in the places that they're used, but permission must be granted prior to visit, and visits are scheduled by the entity requesting the therapy dogs. They require and are required to have good manners, good training, but no specialty labeling or certification. They have to be up to date on vaccines and require minimally yearly veterinary visit. They help with emotional support of the individual. Those with extreme behavior problems may actually require a service animal. So there is a link with service animals and ESA animals with regard to humans, as far as if, and this applies to doctors. If you have a patient that's severely affected by mental health issues, there are avenues for them to actually get a service animal which allows them greater access, meaning they can take them to restaurants, transportation, everything else. They are only, ESA animals are only, dear Lord, ESA animals are only allowed access to housing and transportation. It's written in the rules of most countries that do allow these animals that they cannot be turned down for housing, but even if there is a no pets clause. And most of them can travel on transportation. Pets are required no specialized training, and they require a doctor's letter, which must be renewed every year. And there must be, and this is the most important part, they must have a client-patient relationship to issue these letters. A phone call from a group that says they're going to register your dog for a 15-minute call is not considered a client-patient relationship. And this will become more important the further on in this talk that I go. I'm going the wrong way. I'm having some severe issues here, people. Why is this not going? Excuse me, I'm having some technical difficulties here. There we go. So the benefits of emotional support animals, they're vital in the lives of people with severe depression and anxiety. They are very important for people that have Asperger's. I think that is changing now. People are labeled as on the spectrum. If they're high functioning, these people can function almost normally, and with emotional distress, they can almost melt down or have intense confusion. And so those animals are there to ameliorate some of these problems and restore emotional stability. I've noticed that with the homeless that I worked with in Dignity Village, there are many people that are homeless through undiagnosed mental health conditions. In fact, a large majority of the homeless are homeless because they have mental health conditions and people do not know how to take care of them. And they're adults and they are not medicated, so they have beliefs that they're safer outdoors, or they don't know where their home is anymore, things like that. And they offer intense emotional stability and friendship. And these animals I've found when I've gone to these shelters and to these tent villages are often very well taken care of by their owners. They are often to the detriment of themselves. They will feed their dogs before they even feed themselves. So a lot of people worry about them caring, them taking care of these animals. And my experience is they may have severe depression, but they come to see us every month, no matter how much they feel, how badly they feel. They will show up to get services for their animal. And it's amazing how well they do when they are with their animals. The problem with emotional support animals, and this is getting into the more technical side of things, is it varies from country, disability laws and access. The ADA is in the US and it's been the final last ruling on it was in 1991. UDUC in the UK was implemented in 2012 and includes emotional support animals. Canada, Spain, and most of the UA have animal access laws. Contrary to popular belief, because of the expense of animals, now these ESA pets do not require specialized training, so that is why their general access is limited. But they're contrary to popular belief. Everyone believes that the animals are registered and certified, and they are not. None of these countries have a central registration for these animals. You may have a certificate of training from a trainer that trained these animals, but there is no central registration. And this has lent to the scamming of many a good-meaning person. So to have an animal like this, you must have a documented disability. Lots of people that just want to travel with their pet and have access to trains, planes, and automobiles will oftentimes not have a disability, and then they willingly go ahead and try to register them with an online scam. And if you type into your search engine, you can say ESA letter onto Google, and 3 or 4 companies will come up and they'll say very quietly on the corner, sponsored. And they say that they will get you registered and give you a packet, including a jacket, a patch, and a registration card that say you are registered. Now, they don't ask about the documented mental health issues. They do say that you'll get a call from a doctor, a medical doctor, that's going to talk to you for 15 minutes. And this does not count, in my opinion, as a client-patient relationship. So they cannot be declined access to housing, and the ESA, there is no cost other than maintenance. America is very difficult to tell what's going on with people because we have HIPAA, which was started in the US to keep insurance companies out of your medical records. Now, this HIPAA is problematic because you cannot ask somebody what their disability is here in the United States. Now, that doesn't mean that somebody in Jamaica can't ask from someone from the US about their medical condition because they're not in the United States, therefore they're no longer protected by HIPAA. So I think it's wise to take note of this because if somebody is trying to come into your country with one of these animals, you may ask them what their disability is. You may ask for documentation, more than one letter of their medical disability. And you may ask for proof of their doctor's notes, which must be renewed every year. And there is confusion amongst these people that they don't even realize they have to get a doctor's note every year from their MD. Because of the abuse of using emotional support animals, as of 2021, US airlines are no longer required to accommodate emotional support animals for free during ongoing abuse of policy. So the most often, but the biggest deterrent of all things is a deterrent to disability is access to infrastructure. So people may get emotional support animals, but unless the country is willing to improve infrastructure and educate bus drivers, you have to have kneeling buses for some of these things. Work does not allow emotional support animals. So I think that there are indications that animals at work are beneficial to everybody, including the individual that has one. And emotional support animals are mostly right now, all the service animals are dogs. There is a little leeway with emotional support animals that they can be dogs, cats, birds, rabbits, rats, things like that. It is not recommended that these people have anything like a horse, peacock. We've heard of all kinds of things being as emotional support animals. But this is just a short talk to try and clarify the different levels of access, what emotional support animals are. And they are important in our community, especially as life gets more and more difficult. And as we diagnose more and more mental illness is more rampant than it's ever been. And it's now becoming acceptable to discuss mental illness in public and with your doctors. So with that, my short little presentation, I will say adieu, and I'll open up to questions.
All right, thank you so much. Thank you. Thank you. Thank you. That was so informative. As you were giving your presentation, I got a lot of wows. I didn't know this. This is so cool. Autism dog. So many comments were going up while you were presenting. So thank you so much, Dr. Robson, for your presentation. Proud to say, Yadi, good job.
Got it. Well,
Um,
my apologies for I was having some technical difficulties with a cat and my
Oh.
keyboard, so I must apologize.
Was the cat the one coughing?
No, that was my very ancient Chihuahua with heart disease and a
Oh,
trachea.
oh no.
So I tried to isolate myself, but the cat lets everybody into every single room of my house.
Of course. And our animals, hey, as much as we emotionally support them,
They emotionally support
they
us.
emotionally support. They want to be emotionally supported by us too. Believe it or not. They're like, where did mommy go? So I have two questions so far. Well, I have one in the Q&A, but I have one that was typed in the chat. So I'm going to start with the one in the chat because it may scroll away quickly. The question comes from Dr. Anna Brown Morgan, who says, can more than one pet be registered at the same time? Is a specific pet registered? Is a specific kind of pet registerable? Can cats, birds, and pet
yeah, you can.
lizards?
There is no. That's what I'm getting to. Is there is no, at least in the United States, and I think mostly. I think England has a little more control, shall I say, over their registration and certification of these animals. Because they're the service animals, the service side is so expensive. you are actually allowed to train your own service dog, not ESA. ESA is a pet. So the only thing that licenses them as a ESA is mostly the medical doctors saying this person I think will do well having a pet in their life. If you're depressed, gives you a reason to get up and walk it, feed it, take care of something else other than worrying about yourself. Not that your worries aren't important and not that you don't have clinical disease. The problem with emotional support animals is there's very little research that has been able to be done because it's anecdotal. And so the research that has been done, the best program that I've seen trying to broach this subject, to kind of give these guys a little more support is the University of Toledo. They have a HARP, the program's called HARP, and they've rescued dogs from shelters that met the right temperament to be calm, collected, not bite. You can't have guests coming over and having a leg bite or something like that. You can't have a cat that's shy and hiding all the time, because this is for that individual. It is not working for that individual. So the HARP program actually tested cortisol on people as they came in and got their animal, and they petted it for 10 minutes. They tried to check cortisol levels. They were able to prove that cortisol levels went down. And they were testing another amylase product, which I didn't fully understand. I'll be honest with you. I have to do some research on that. But they showed indication that there are ways to prove that these animals are important to people with these high cortisol levels. And their cortisol levels would drop after petting the animal.
Wow, nice.
So the emotional support animals are they have less training. They are just pets, but they should be selected carefully for the owners, and they can use their own pets, but they have to have a doctor, have a disability first of all, that's registered, which can only be determined by their doctor that has been following them for years. They're on medication, and their doctor is willing to put their license on the line and sign that this pet is important to this animal. And sometimes work areas in the United States have allowed those notes to be transferred to work environments. So they will sign two letters that this animal is necessary for this human being to be a human being and to help them be their best selves. They also have them for work. And that's why selection of an emotional support animal, you don't want something that's high strung, a calming, influential animal. And unfortunately, I see this being abused, especially when people are wanting to travel with their pets overseas. They're getting, and I'm not kidding, when you type in, ESA registration into your Google app, you will find that there's all these people that say, we are the ones that register and certify you. Those guys, they don't do it, but they all say that about each other. But they will have a doctor call you and talk to you in 15 minutes and sign off on a letter. So for protection, because it is a concern, I think medical records should be required. Because if that's the only reason they have an emotional support letter, is that 15-minute conversation, that is not a valid emotional support animal. And it's making it a terrible problem for people that really need these animals. And if you have an unruly animal and you're trying to convince a local government that these animals are supposed to get on buses and things, especially in Jamaica, Lux, dog, can't be on bus. You try to put it on the Knutsford Express, they're going to just have a cow. They're not going to do it.
Well, actually, I think of all the buses we have, they might be the first.
They might be the first, absolutely.
I mean, I don't know if they will, but if I was to bet money on which bus would do it first, it might be the Knutsford Express, followed maybe by the big yellow electric buses, but not the coaster bus for sure. All right, so I have a number of questions. Let me see how much time I have.
I know Dr. Cadogan
yeah.
wanted to raise a question as well.
Yeah, it's more
He's
of
gonna
a,
have too much
of a
privilege, you
comment,
know.
really. More of a comment, really. And Lesley can comment on my comment, but yeah, because one of the reasons why I had the idea for this presentation was because of my own experience. Well, one, we've had dogs when our Jamaican laws were being changed as far as dog importation, emotional support animals were kind of allowed in under those circumstances, you know, with the letter, etc., etc. But I did have an experience recently where a client who was living in the States took his Jamaican dog to the States and then was asking me to write a letter stating that this dog was an emotional support animal so he could have him in his apartment without paying any extra for him and take him on the plane and on the bus and that kind. And I said, no, that's not my purview. That's for your doctor to do, right? And that's where I left it. But I said, you know, really and truly, this is something that we need to have more awareness of you know, the dividing lines between between all these categories and how people might get the wrong idea as far as, you know, what they want to do with their pets. It isn't that right, Lesley? Unmute, Lesley. Yeah, you're muted again.
So cats, I'm gonna blame it on the cat this time. No. You're right. It does require a medical doctor to write that letter. And the only thing you can say is when the dog left the country, the dog was in good health.
Right.
That's it. So he is trying to jiggle his way into an apartment that probably has a no pet clause. And he has to, again, have mental health issue and be under the care of a doctor for that mental health issue to get an emotional support animal.
All right, great. Thank you for that. Okay, so let's see if we can get through some of these questions.
Sure.
So the first question is from Grace Hall, who asks, are there particular breeds that are more suited to be recruited as an emotional support dog?
Yes, I would say obviously labs fall into the big category, golden retrievers. But if you're wanting to travel with it, these are not always the best animals. So you want to go with smaller. Any dog, it's all about temperament for emotional support animals. So any dog, and that's why with the HARP program, they were joining up. They looked at all these animals, and the very sweet ones that wanted to cuddle they tested them with dogs, cats, children. They have to be okay with all of that, but mostly with emotional support animals, it's about temperament. And this is where veterinarians can come into the mix. In the One Health, if you're looking at MDs trying to figure out, well, what do I get this person? And cats, let's not forget cats. Cats are great emotional support animals. And so are birds. They talk. You know, it just requires whatever that person, if that person finds that animal helps them, and say they were in a house and they have to move and they've been under the care of a doctor, and they go in and they say, you know, I have to move to an apartment that doesn't allow animals, and my bird has been very, very implemental in my health care for myself, then a doctor should be willing to sign off on that. But again, it all comes down to the risk to your license, and doctors are not going to sign any animal up that if they're going to get a call from, say, Jamaica or Trinidad and says, there's an emotional support dog here that you've signed off on, and they say no. Because I've seen people actually type up their very own letters and just look in the medical registry and just put the doctor's name there and scrawled something.
Wow.
They faked them. And that's what I meant uses and abuses, because there is a lot of abuse in the emotional support animals.
Okay. Wow. Okay. All right. So temperament over breed.
Temperament over breed. And
Okay.
actually there are certain breeds that are used, the larger breeds for guide dogs. These are more in the service department, but we weren't talking about those guys today.
Right.
So yeah.
Right.
With service animals, there's a little more having to do with size.
Right.
And
Right.
temperament as well.
Okay, Bradley Edwards asks, with an increase in private flights to Jamaica, do
Mhm.
we know how vigilant we are about animals coming into the country? I'm not sure this is a question for you.
Well, I know a lot of those private flights come in, and I do not think, because they're met at, like, say, let's use Goldeneye, for example, that airstrip in is
St.
it yeah, it's in St. Mary. I do not believe there's even like a huge somebody from customs goes in, as far as I know, and they probably don't know yet. So they probably should show them paperwork, a little vest, a little patch, and off they go. So, but they must get a doctor's note every year, and they must get a veterinary checkup every year, and they must be current on their vaccines.
Well, I feel like this is that one might be a question more for the VSD, so we'll
Yes,
see how
it
that
would.
goes.
Yeah.
So and I'm pretty sure, there's an answer from the VSD rep in the chat that says airport is monitored by VSD and an officer is assigned to the airport for all flights. So
Yeah.
I'm sure that there is some monitoring going on.
It's just how much in-depth scrutiny can you put into that one animal with one jacket? I mean, if it's a small animal and it's behaving itself well, I mean, who's going to argue? Now, if it's gnashing its teeth and growling at everybody, then you have a concern.
Mhm.
You know, so I think ESA slipped through the system, because how much of a hassle and time is it going to take for a very busy service to verify every single one of these animals if they're coming and then going back out to the island?
Hmm.
You know, as far as the emotional support aspect of it.
Right.
But if it's
Something to look
behaving
into.
well and it's reasonable, then I think they would say, okay, you are, off you go. So,
All right, so 2 more minutes and 2 more questions.
sure.
Julianne Small asks, can any medical doctor issue a yearly note, or does it need to be a psychiatrist/psychologist?
Tricky question. I would recommend, for the validity of the thing, if you're a mental health because I know regular practitioners do also handle mental health issues, especially the ones that aren't so severe. They will, they can write a yearly letter, but they have to also have the medical records to back it up. Now, if you're going to a specialist for your medical condition or your mental health condition, then it would be wise probably to get the letter from that person. But you can get it from your primary care doctor if especially if they're collaborating. And that's
Right.
what we need more of as well. Is I know
Right.
in the States we've gotten specialized to the point that we're hardly talking to each other. So
Right.
and that's
Sure.
a big problem as well.
Mhm.
But yes, it should come from the person that's handling your mental health issues.
Right, exactly. And
Because they
then,
might get a call.
mhm,
Did you authorize this letter?
exactly.
Yeah.
And then the last one, let's see if we can keep your opinion short, but what is your
Yeah.
opinion of ES animals in the workplace?
Depends on the workplace.
I think so too.
If
My
you're
workplace is in my car
exactly, so
and I
you could,
go from farm to farm.
yeah, but you could
So
potentially have somebody.
I could probably have a dog in the car if it stays in the car, but
Exactly.
you don't want that dog coming out and going from farm to farm.
No, you do not. So
Exactly.
the other thing is, if you're an ER nurse, that's not going to work very well.
Right.
You know, so I think people that work in cubicles on computers, especially if you're an agoraphobic, somebody that can't get outside, and now remote offices are more acceptable these days since COVID. But I do know some people that have, like a golden retriever that just lies under their desk. That's
Right.
perfectly acceptable. But
Right.
that has to come from the workplace, because you cannot override, they don't have general access. which means they can have home or transportation. If they want to be able to take their dog to the workplace has to be willing to accept that letter.
Right.
You cannot force them to accept your dog or cat.
Thank you,
or bird.
thank you so much. And I'm going to cut the questions here. It has
Yep.
been an amazing presentation. I mean, if I was to try to summarize what was happening in the chat, it's just, you know, scammer everywhere. I saw a Doberman come in on a flight in my early awareness. Expect. This presentation is so very interesting and informative. Would you be available to give this presentation in another forum? Could we get your contact information?
Absolutely.
That one person was like, your mic is muted, unmute. I've had patients who feel guilty because they grieved more with the loss of their pet than with the loss of a relative that's coming from a doctor.
Yeah.
I had a tutor at school from the US who traveled with her dog, and then there's a very active chat about the VSD monitoring the flights and their strict rules on service dogs because of the abuse and false declarations, and even a link that talks about the health requirements for animals to enter Jamaica. So if you haven't seen that yet in the chat, there is that link there. You can go there, get the chat. I can even ask Dr. Robson to put her contact information in the chat. And one person says we were captivated by the presentation. So wow, you're captivating, Dr. Lesley, captivating.
Well, apparently my talk going backwards and forwards because
yes,
and like, oh dear Lord.
And the coughing dog and the meowing cat. I mean, everything was perfectly veterinary and perfectly captivating. It was just great. So
I'm in Jamaica quite often actually because I do spay neuter work under JSPCA. So
yes,
I'll be happy to talk to anyone.
Awesome. And Miss Tomlinson, I apologize. Okay, I guess this one is a fun one. I really am taking liberty here. What's the most unusual animal you've ever seen? I don't think Tomlinson meant to write as a support dog. I think she just meant
support animal.
As a support animal. So
it's a
most unusual support animal.
It's a toss-up between a snake and a peacock.
All right. Well, we know snakes go to the Bustamante Hospital as well. So we're pretty sure snakes are good emotional support pets here. That's not unusual for me to hear of. All right,
I'm sorry to interrupt. Snakes go to the Bustamante Children's Hospital?
Yes.
Sam, weren't you here last year? Remember the presentation on the...
Oh, from the zoo. Okay.
Yes,
yes.
I apologize. Not garden snakes, Sam.
Okay.
We not carry regular snakes.
All the staff were wearing around their neck and walking around the hospital having a good time after being here.
Sam.
Yes, you're so right. You're so right. I remember because I wasn't
kittens,
there. That's true.
Rabbits, and dogs, and Dr. Teddy Barks all go to the hospital to become emotional support pets there.
I think the key thing to remember though with all of this is they are not service animals.
Right.
There's a whole different ball of wax over there. They don't have general access.
All right, so I definitely have to stop now. I've taken us 5 minutes over. Thank you so much. Fire in the chat, fire in the emojis. Let's go. So let me see all of those. Yes, look at them. They're coming. Somebody put a snake emoji in the chat. Thank you so much, Dr. Robson. I believe we have to run quickly on to our sponsor presentation. So I'm going to turn that back over to Sam. And thank you again. Big up, Yadi. We love it. And we don't want to be able to take my patio out of my suitcase. Them can go. And have a wonderful, wonderful evening, and let us move right along. Thanks so much.
No problem. Thank you so much. Wonderful presentations. And now we hand over to our next sponsor, which I believe will be Smartline Pet Products. And the representative is with us. Thank you. Is Jennifer Mahfood. Jen, I do have a slide here that I think you left out and a video. Do I just add it and play it for you? Or you want to talk to the people a little bit before I play it? Let you unmute first. Here you go. You see that pop-up saying unmute? There you go.
Okay, that's fine. No, you can go ahead.
Go ahead with it. No problem. All right. Thank you so much.
Oh, that. All right.
All right. So the Smartline Pet Products, Smart Pets Trust Smartline, 2-8 Bird Sucker Lane Kingston
Smartline.
6, as you can see right here, and then we have a video for it.
Thank you.
Welcome to Smartline Pet Products. We are the Caribbean's foremost leading manufacturer of over 16 to 17 products. We first started off with our original line of shampoos, which boast of, this was the first product manufactured by us over 25, 30 years ago. We've been in the business over 50 years. I'm a professional groomer, so we got a wonderful cosmetic manufacturer to develop products with my input. So this is our flea and tick shampoo. This is the best seller. It has the active ingredient of cypermethrin and piperonal butoxide. This is our aloe vera shampoo, wonderful cleansing agent, smell, healthy. This is the oatmeal and avocado and sunflower. It has oatmeal colloidal in it for a gentle product. Then we have our super whitening for whitening a dog's coat, taking out the yellow. You can also use this as your first product to shampoo with, and then you can move on to maybe the oatmeal depending. And then here we have Ortho Remoisturizing, which is a super moisturizing product. It has silk peptide powder, sunflower oil again, and avocado oil. So you can always use this as your second line, or after the flea and tick, you can maybe use a remoisturizing. You can blend them together. Then we have the conditioner that matches it with the silk peptide powder, the avocado, and the sunflower oil. And here we have a cologne, a fragrance for your pet. So we also manufacture human products, which is Island Skin Line, a line of body oils and face oils. So I'm into nourishing the skin naturally and in a healthy environment. Our second line of shampoos, the ultimate in pet care products, and this is called the aromatic line. This is aromatherapy oils and natural ingredients to make for healing for your pet's coat. So here we boast the argan oil shampoo for dry, brittle coats. That was a huge favorite. It was one of the first shampoos that we came out with the aromatic line. Also has a wonderful fragrance to it. Then we have the Luster Coat. The Luster Coat is a hypoallergenic shampoo. It boasts a pina colada fragrance. Very special product. This has been, this is one of the leading shampoos that we sell. Then now is our newest addition to the aromatherapy line, which is the lavender shampoo. And as the name depicts, it's lavender oil. It has a lavender fragrance. Nice product to be using on your pets, whether it be a small dog or a big dog, the golden retrievers, all your small breeds. Here is our last product in the aromatherapy line, which is the Wonder Coat. The Wonder Coat is a natural flea deterrent. It boasts citronella, lemongrass, cedar oil, clove oil, and peppermint. It's also a great skin booster. So if you're having problems with dry, flaky skin, you can always use our Wonder shampoo. So we're also now the distributors for the salmon oil. It comes from North America, from the Atlantic, and it has a wonderful taste. Dogs love the taste. It's getting to be quite a popular in fish oils on the local market. The third aspect of our pet care line, which is Heal and Protect. This is an animal wound powder which I put together over 30 years ago. It's only gone from strength to strength. We manufacture it here. So it boosts sulfathiazole powder, cornstarch, zinc oxide, gentian violet, isopropyl alcohol. It's for skin abrasions, for wounds. It's a wonderful product to have for your household. Then again, we have the 5% Protect for dogs, cypermethrin. This is a dip that you make in a solution. It's very safe. It's quite safe. And what we do is here at Dogs World, where we groom, if an animal does have parasites, what we do is we mix a solution, put it on the animal, leave it on 5-10 minutes. Then we shampoo, rinse everything off. I don't leave insecticide on an animal. I do not believe in that. Then the third aspect is treating the environment for fleas and ticks. So you can either go back to the 5% or we boast a 20% Smartline yard and kennel spray. So here you can use this to spray your kennels, to spray anything to do with external parasites. So there we have it, the full range of Smartline. There's something for everybody. We are export ready, and we are the Caribbean's leading manufacturer in the pet care line.
All right, thank you so much. So ladies and gentlemen, those are the products from Smartline Pet Products, and we thank them for being a sponsor and for supporting. Please take a screenshot or take a picture here of the phone number, of course, the email address and the website there to stay in touch and be in contact with them. All right, I think it's back to you, Dr. Kathy. Unfortunately, I'm not seeing our next presenter, Miss Sherine Huntley-Jones, Mrs. Huntley-Jones, apologies. I'm not able to get through to her as well, but I think we continue on to our final presenter.
Okay, Sam, thank you. We may end up having another presentation. I got a direct message, but we'll see. But for now, we definitely will go to Dr. Aldyth Buckland. And I don't know if we need to introduce this lady if you've ever been to this conference before. I mean, come on. How much more time can this lady present? We love her so much. Dr. Aldyth Buckland, graduate of the University of West Indies, MoHW, accredited member of both the Caribbean College of Family Physicians and the International Board of Coaches and Practitioners. She's an accomplished and experienced family doctor in her own private practice, empowering herself, her patients, and their families to take charge of their life and health through participatory integrative practices. She has mentored UA medical students in general practice specialty. She's a 2025 Star Doctor Awardee of the Caribbean College of Family Physicians. She serves as a member of the WONCA Working Party on Mental Health. She's a past president of the Caribbean College of Family Physicians, JA, vice president of the Association of General Practitioners of JA, member of the Medical Association of JA, and is its insurance committee chair, an honorary member and volunteer of the Jamaica Cancer Society, serving in smoking cessation training and guiding the public in lifestyle interventions. She is certified in Caribbean Climate and Health Responder course by the Global Consortium of Climate and Health Education / Columbia Mailman School of Public Health / Earth Medic / Earth Nurse. She represents, look here, what this lady don't do. She represents the Caribbean College of Family Physicians on the Caribbean Regional Hub of Planetary Health Alliance, along with Dr. Paul Cadogan, who is Mr. One Health, Dr. Aldyth Buckland, who is Mrs. One Health, serves as co-chair of the One Health Conference. Dr. Cadogan just dropped out of his chair. A collaborative venture between the Jamaica Veterinary Medical Association and the Caribbean College of Family Physicians. She has 2 grown-up daughters, a loving family, wonderful friends and colleagues, enjoys nature, practices yoga, qigong, and meditation. I did look it up so I could pronounce it correctly. Listens to music, plays with her dogs, and serves the Almighty who makes everything possible. Ladies and gentlemen, welcome Mrs. One Health herself, Dr. Aldyth Buckland.
Dr. Balkan, you're unmuted. We should be able to hear you. Can you hear us?
Muted?
Yes, you're good. We can hear you. You just need to go to your PowerPoint now.
Okay.
You're already sharing screen.
Okay.
There you go. Perfect.
Oh, okay, good. Great. Hello, everyone. I'm glad to be here. And my new name is one. That's so funny. And this topic is on emotional support, how we help each other, helping family, friends, and colleagues in need. And remember, in our family, we will also have our extended family, which would be our pets, could be our plants as well, whatever it is that we call family. Okay, now, you've heard this term awareness. Well, awareness is actually a fundamental quality of mind. It is what we call our consciousness. So, are you conscious right now? Awareness is the capacity of knowing what you are thinking, feeling, seeing, doing. So I'm going to ask you just to come on a little journey with me and just glimpse your mind being with your breath. So breathe in and out, knowing that you are breathing in and out. Are you breathing in and out? That means that your mind has connected with your breath. And so you are consciously aware. Imagine that you can see a clear blue sky as you breathe in and out. One moment, Sam, can you see your Allgate thing? Can you see me? Anyway.
Oh, so sorry, I was muted. Yes, Doc, I can see you.
Oh, okay, because I see Allgate. All right, okay. So continue breathing in and out, connecting your breath. And imagine, or you can just look outside and see the clear blue sky, but do it in your imagination. You see a clear blue sky as you breathe in and out. Now a thought happens to come across. I'm going to represent the thought as a cloud. And the cloud could be something like panic. And it's coming across the sky as you breathe in and out. Just continue breathing in and out. In and out. And watch that cloud as it changes shape. The cloud may also be charged because it can be a thunderous cloud, and it's just sending these currents of electricity down. And the dogs don't like that sound. They will run and scamper. We don't like to hear it either because it just vibrates the entire building. But this charged emotional feeling is this charged feeling is really an emotion. Just continue breathing in and out. This practice. So you can have a thought and you can have an emotion. Whether it's right, that's okay. Whether the thought is wrong, it's okay. Whatever happens, it's okay. Continue breathing in and out and just watch the sky. The clouds, because the clouds will pass and the clouds will change shape. You know, we always like to say this too shall pass. No matter what it is in life, this too shall pass. So we want to be able to listen to ourselves, and be aware of our breath as we breathe in and out. The capacity to listen to ourselves means that we need to be silent. When we are still, we can connect with the Almighty who makes us, and we can just hold on to his powerful hand, no matter what. Some people may have a spiritual leaning, others may not. It's okay. Just know that you can stand up. If you're feeling funny, you can always stand up. Funny means you're not feeling right. You can stand up and have a more, energetic pose, which allows you to feel grounded and in charge. All right, so everybody, no matter what it is, you stand up. And if it is that you're sitting, you want to sit up and you want to look up and out. It's important also not to look down, because check what happens when you look down. And then look up. You feel the difference. You sense the difference. And then stand up. And you can hold your hands over your head and you can clap your hands. That's what Usain does. He engages his crowd. Because this actually puts you in a very powerful state. Very powerful emotional state. And it grounds you to be the best self you can be. Now, it's important that we all realize that we process things differently. So we take in messages from the environment through our eyes, our ears, our nose, our taste, and our feeling. And that's all it is, just message. And whatever feeling we put on it, it is something that we happen to have come and merged in at the same time. All right, so if something is really, it's a very powerful charge and we are frightened, that feeling of fear will come in and we see whatever and we say, oh, I'm afraid of lizards, I'm afraid of cockroaches, because we see it and we remember that. And because we probably also saw somebody scream, we also felt that way. Sometimes people may not want to go to a hospital because, oh, so many people died there and they get a funny feeling about going to a hospital. Whereas we may not have that same feeling because we're going to help people. So we process things differently. It's either our perspective or in our imagination. So just know that whatever our perspective is, somebody else has a different perspective or somebody else has a different imaginary thought. Because sometimes we're talking to somebody or a group of people and you don't know if they ever licked their head before or if they're on drugs or whatever. So just, what we say in Jamaica, have manners and respect for ourselves and to our fellow man. We do not know where the person's headspace is. So, you know, when the police are doing their things, stopping people and then they want to just load up people into a truck, they don't know what is happening because people are frightened and then they may actually have a different perspective in writing up the charges for people that they load into a truck. Just a perspective of mine, all right? But we all process things differently, and so we need to have compassion on ourselves and compassion on other people. Because some people experience things that are unfamiliar, things that really don't give them any pleasure, things that are unfriendly, and they're going to just stay away from certain things. Whereas if whatever it is familiar to them, or they have had pleasure in the past, or the thing is friendly and they experience something else that looks like it, they're going to put it in that file drawer. This one is okay, I can go toward it. But remember that we process things differently and we must be compassionate to other people, including our animals, because they're also processing. So our response to stress, everybody's response to stress, which is an overload of the body or overload of the mind, is different. Some people are in the green zone here, which is social engagement. People who are socially engaged will experience joy, they're feeling in the present, they're grounded. People who are socially engaged may actually be going to the gym. They may actually be going to the hairdresser. Who doesn't like to see? Just doing certain things, or we may actually be going out with the family to a picnic, or daddy or mommy or somebody is going to play dominoes with us. It's friends night. Social engagement is just pure fun. And whenever that is like that, we are just feeling great. However, you have other people who, and it could be us too. So when you look at this chart of social engagement, sympathetic, and the freeze phase, right now, where are you locating yourself? Are you in the social engagement plane, or the sympathetic plane, or the dorsal vagal plane? The sympathetic plane, you could have frustration. You know, right now I feel so frustrated with flow. Anybody ever felt frustrated with flow? Yes, but just remember that is an event. Not upset with the people there, it's just their system. And every day I hear, this is what is so wonderful about our Jamaican talk shows, because people can get to talk and ventilate. I do not know another place in the world like Jamaica where we have these talk shows where they can even talk to Dr. Mary. Dr. Mary, and Dr. Mary just engages them so nicely, or they call this other station and they just express themselves, and other people, yes, it's so cool, but you're feeling the sense of a group through the media. So frustration, irritation, anger, rage, all right? And this is in the fight phase, bum, bum, bum. And then you have other people who just have worry and concern, anxiety, fear, panic, and they're going to stay away. So many of us are in the sympathetic zone, and we can be in the social engagement zone in one moment of time, and in the sympathetic zone in another moment of time in the same day. And then look at this, the freeze zone, where people feel helpless, they feel they need to conserve their energy, they just feel depressed, numb, they are just want to disconnect with whatever is going on. Some people feel so ashamed, they shut down, they have no hope, they just want to die, they just see themselves in a coffin, they just feel trapped. And sometimes I find that, honestly, sometimes some of our businesses that used to be more socially engaged, what they have done is to outsource it, let go their staff, and then they outsource to another company that will employ and then send another company workers, and then these workers have no benefit. So they get a sense of hopelessness for the workers because they just feel trapped. Is this indentured labor or slavery again? So it's all of these things that are happening in the emotional workplace. Some people feel trapped because they feel so tired, they have not been relieved, like security guards, maybe doctors, nurses have not been relieved, and they have to continue, and they're hungry. That's another thing. You see this thing called hungry? Hungry is something that you want to make sure you're not, especially if you're going to work and work with people. So where on the chart are you now in this? What will help and hurt? Remember I told you about the processor upstairs here, right? What will hurt our processor? I want to talk about HALT. It's an acronym for hunger, anger, loneliness, and tiredness. What is it? If you're hungry, you're not going to process. In fact, if I come to you as a patient, you may not even be listening to what I am saying. You're just ready to get rid of me. Or you could be the best surgeon. But if you're tired and you haven't slept, although you're the best surgeon, when you've slept, you may not be very good to work on me if you're tired, because mistakes, the risk of mistakes can happen. So Whatever hurts our processor can also hurt other people. You see how connected we are? Hurt people hurt, right? But we need to make sure, careful of hunger, anger, loneliness, and tiredness. We will see how to deal with anger and loneliness with our SHIELD. What is SHIELD? That's another acronym. S stands for sleep. It is in sleep that we restore and recover. There's a time for work and there's a time for sleep so that our system can go to its garage and get fixed. If our system does not get fixed and upgraded and restored, then we are not going to be clicking properly. So sleep is very important. It's important to have one sleep schedule. If you like coffee, make sure you don't have coffee after 2 p.m. if your bedtime is at 10, because it has a 8 hour before it wears off. 3 hours, you want to have no alcohol before bedtime. 3 hours is alcohol. 4 hours before bedtime, you really don't want to do any strong physical activity because it's going to interrupt your sleep. And then 5 hours, you can go to bed and then give the sun a high five. You know what is important about sleep? We need to understand something about a switch. Our eyes are not just for seeing, they are receptors. It has a switch for sleep and a switch for awake. And the light, when our eyes see light, it is going to switch on awake. So if we're watching a movie on our tablet or on the computer or on our phone, and that light from the screen is getting to our eyes, we are going to have trouble sleeping. What we want to do is put the devices to bed. We're going to bed, the devices go to bed. And in your family, have everyone in your family put the devices to bed. There needs to be a rule for the screen business. Because if people in your family don't sleep, you are going to have a very quarrelsome family. People who don't follow instructions, people who don't do any homework, people who just don't do what they're supposed to do. They are just not functioning properly, you know? And then they can be moody. So sleep is very important. H is help for stress. Help for stress. So I mentioned some things for help for stress. One thing for help for stress was the breathing. Another thing we mentioned was sleep. We talked about help for stress, going for a walk, maybe in nature, which is wonderful, especially early in the morning. Help for stress, maybe going to exercise, or if you want to go to the gym and see your friends and also work out. Yeah, man, that is really nice. Or if you want to make an appointment, just go to the hairdresser and you smell the salon and whatever, and you get this lady gives you a massage. Nice, you feel really, really, really good. Now the help for stress is something called self-havening. So in self-havening, just bring up a picture. Just imagine what happened today and think of anything that may have been very stressful. Breathe in and out. In and out. And then put your hands right here and just gently stroke your arms. Thinking about that stressful event just needs 5 minutes, even in a ward or a hospital or wherever you are. And just keep doing that. It's not an intense pressure you're putting on your arms. You can even do it on your face. You can do it on your head. But make sure you wash your hands before you touch your face. Then go under. Then rub your hands together. You can do a mixture of anything. This is what we call a psychosensory technique. And what it does, it induces delta waves. It induces delta waves that goes to the amygdala. And it dephosphorylates the AMPA receptors that have a role in binding stressful emotions in there. Because when you do this, you notice that you're going to go from like a 10 And you keep doing it, it's like it just goes right down to zero. Just keep doing that. And you can teach your family and friends and colleagues to just sit quietly and breathe. You can look on YouTube for maybe for videos of this. Self-havening. The delta waves that this generates are low energy waves compared to the gamma waves for the stress. You see those, the fight, flight, and everything up there? That's high energy waves, and it just puts us in a spin. You know, there's a certain device, and when it looks at the wave patterns of the nervous system, it goes jaggy, 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 jaggy. It's really jaggy. But when a person does the self-havening, when they do the self-havening, they get the delta waves. You get the delta waves also when you're with a pet that you love. When you stroke your cat, when you stroke your doggy, when you look in the eyes of your doggy. Nice, Rex. You know, you just love this animal. You feel good, and the animal feels good, and there's pure waggy waggy going on. So animals are really very therapeutic for stress. So that's havening. So H help for stress was the breathing, remember the sleep. You can be socially engaged, going to the hairdresser, the gym. Even praying is important. Yes, very important. And so that's help for stress. Another thing for help for stress is to even question our thoughts. We need to really be at cause for our solution, because sometimes we want to stay in our comfort zone and don't step up. Don't step up to be involved in something new. You don't need to know about the thing. You just step up, get involved, and learn. It's just called learning as you go. Because what is a big university is a school of life. So empowerment is putting you at cause for your solution. And attitude is an inside job. So you want to say, how will I show up during this crisis? You can ask your family member too, how will you show up? We need to move from a fear zone to a learning zone to a growth zone. Because when we grow, we know we're alive. Basically, if you stop learning, it's like you're really dead. This empowerment is when you are at the effect of others. You know, they want to order your own, and stand up for yourself. And you're saying, you know what? At me on floor the other day, I said, no, I do not agree with this bill. You have not been following the contract. Certain things I was saying to them. But basically, you want to be able to know that you can stand up for yourself. You can't stand up for yourself, then you think people can stand up for you, help you can help you. However, you want to learn how to stand up also for yourself. Because when you can do that, then you can show your family how it's done. Life balance audit. Now, I was just thinking, a lot of us have our phones, and suppose we lost our phones. Our phones have so many names and contacts. How would you feel if you lost all of that? Who are you going to call at 2 o'clock in the morning? Do you know who you'll call at 2 o'clock in the morning if something happens? So who in your family or who in your group, your friends group, can you rely on to help you in case there's a problem? Can they rely on you as well? Do you have a sense of control? Having a sense of control, remember, you want to practice breathing. Remember, it is just breathe, keep your mind with the breath, and you see the clear sky. Clouds may come, which is the thoughts, but just know that thoughts are going to pass. Sometimes we put a feeling onto these thoughts, and we think it's so, but it's really our imagination, because we're playing or borrowing something from another occasion and putting it onto that. Or we hear gossip and we won't put it onto that. Or it's a misinformation we hear on another media. So be careful how we engage with social media. So you will need to also be comfortable with unpredictability. Be optimistic that all the bad situations will always improve. Remember, look at the clear sky. Look at the clear sky, the clouds pass. This too shall pass. Know that your life has purpose. My life has purpose. You know what? I matter just as you matter, just as we all matter, just as my pet matters. You know, yesterday, I just come home, did a house visit on somebody. And then when I came up the road, I saw a little cat in the road. And it's a little cat. It's a cat that belongs next door, but I really love the cat. I call him Tom. And he goes, meow, meow. If I'm going for a walk, Tom wants to trot behind me. I say, you can't come with me. You're going to attract the dogs. So I'll put him inside and I'll put him in a cage that I have. And when I come back, I'll let him out. But he was dead. And I was just so heartbroken. I said, Tom, wow. You know, accidents happen, you know. Anyway, I wrapped him up nicely and put him in a bag and another plastic bag. And my gardener came today and we had a little funeral service over Tom. And yeah, we did some singing and clapping, but that's part of my therapy, you know. But, you know, if we you know, even in an animal, we can get love from. You don't have to necessarily get love from people, but get it from animals too. In fact, the more the merrier, you know, just be open. Just be open to it's just to be open to all opportunities for love, because you can give love and you can receive love, right? So I believe my life has purpose. My purpose in life is to radiate the love and the meaning that I'm here, which is to share that life matters, you know, that people matter. I participate regularly in at least one of the activities that we mentioned already, all right? So try and strike a life balance audit and know where you are for this, where you are. See if any of the things that are stressing you out, see where you are in that audit and get a support group. Your support group can be in church. It can be even in our medical meetings or whatever group you want to be in. Just get into a group. You know, you don't want to be alone. You want to be alone sometimes, you know, but you don't want to be lonely. You don't want to be lonely. So take care of yourself so that you can be there for others. Make time to be alone, uninterrupted. You want some quiet time where you can think about what you want to do for the day, plan it, what you'd like to do for the day, who you'd like to help for the day, you know, plan certain things. And then at the end of the day, you look back at it and give thanks what you've been able to do. We need time alone so that we can decompress, we can really do some critical thinking and planning. We need to set aside our technology at least once per day. Set aside the technology when you're going to bed, turn off the radio if you're driving. You need some downtime. Don't jog and have something in your ears. Let me tell you why it's so important. We have a conscious mind and we have a other than conscious mind. The other than conscious mind is very important to us. Our conscious mind is what you call a goal setter. It will set the goals. But if you want to get to the goals, you need to involve and engage the other than conscious mind, which is your goal getter. To engage your other than conscious mind, you want to tune out from all the distractions that you like to put in your ears, that you like to listen. You're just distracting yourself. You're on social media forever and ever. That's total distraction. You're being trained by AI. You're being trained by AI. The other than conscious mind, AI does not have. That is why we are better than AI. AI has been trained by humans' consciousness, but it has not been able to grip into other than consciousness that we have. Let me put it how big this other than consciousness is. If I happen to stand up and my feet are like in an area that is 12 inches, that is my conscious mind. It's a little bit, but it's supposed to set my goals. But my other than conscious mind will stretch 7 miles right around. It's huge, huge. You want to engage your other than conscious mind just about when you want to go to bed. So you can sit, when you're going to bed now, this is how you do it. It's nice, you know. This is how you do it. You think about what you want to do before you go to sleep. That's why your phone must not be with you. That's why you're not watching a movie or whatever, because you're going to, you have some wonderful things to do. It is just to get into another place where your other than conscious mind will take you leaps and bounds into another area that will get you solutions quickly. So you think about what it is you want to do. Say, for example, I'm studying for an exam. I can look at the questions. Maybe I've been to the class, but maybe I haven't really read the book, but I've been to the class. I've heard the discussions, and I look at the past paper questions. I say, okay, and I shut my eyes because I know that I need my sleep in order to answer the exam paper. So I go to my bed and sleep. I get a good sleep. And when I wake up in the morning, I can answer all the questions that are right. And they're right, because if you check back the book, you're right. You want to try it out for yourself, but it always works. If anything you want to work on that you feel stumped on, you just go to bed, it's like you sleep on it. And then as you wake up, the very first thing, before you even go to the bathroom to pee, get a book and you just write it down, because it's called thought dumping. The other than conscious mind has processed it already and given you an answer. So you write it down because that is what you need to do. Because it has gone through everything, all whatever inside yourself, whatever, and it gives you an answer. So make time, uninterrupted, set aside the technology, start doing only one thing at a time, turn your car radio off, develop ability to think out aloud. Sometimes I'm talking and I'm whatever, and then my patient said, Doc, remember you said whatever, and I said, oh, you know that? Because you said it, because I think aloud, right? You want to have somebody as a listener listening to you think aloud, because you're getting feedback. The feedback may be, Doc, I don't agree with that. I said, but who tell you that? You know, so you're listening to me. Be open to being coached. Be open to taking lessons, and asking for help does not diminish you. Yeah, if you need extra help, and all of us need extra help. Let's go ask, seek, and knock. Let's get the help we need. We are going to grow and get out of our comfort zone. You can get feedback from another on your performance, and this leads to insights. You're better when you're being watched. Take lessons from a pro. Working with an expert lets you know what good practice looks like, right? This is taking care of yourself and other people. Surround yourself with people who are better than you, and be curious how others do it so well. The serenity prayer. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Now, in relationships, we want to set certain rules, especially when we have even children. We need to set this rule for ourselves. You know, this Jamaican thing that says, spare not the rod and spoil the child. Oh, the child must get licked. How dare the government say we mustn't lick our picnic? But you got it wrong. That was a perspective. And you got it wrong. You have misinterpreted the scriptures. Because when it says, spare not the rod, what it means is this. So we're talking about David the shepherd. And David the shepherd was looking after sheep. Do you think the shepherd go around and beat up the sheep with a rod? No. The rod is there to ward off the wolves, the creatures that will come and attack the sheep. Spare not the rod means that you're going to protect your children. It is not to beat your children. So when you say spare not the rod and spoil the child, it does not mean you're going to take a big stick and lick a picnic. Picnic means child, right? Children. No, picnic is child and picnic them is children. That's right. So let's get that straight in Jamaica and in the Caribbean, because that is how we grow, hearing about spare not the rod and spoil the child. It's supposed to get licked. That's what the scripture said. The scripture never said that. It's taken out of context because We don't understand about shepherding. We don't understand you don't lick sheep. No, sheep are very so mild and meek. They won't hurt a fly. How are you going to let your rod and beat up your picnic? You have other ways. You have other ways in which to engage your child. So I care rules for family. We listen to each other. We need to show manners and respect, even in the family, right? We listen to each other. Hands are for helping, not hurting. We are to use I care language. Thank you. We care about each other's feelings and we are responsible for what we do. We can have peace rules. Remember I care rules, you can Google I care rules, all right? Peace rules. We cooperate constructively. We speak respectfully. We listen with an open mind. We act with kindness. We respect each other's feelings. We take responsibility for what we say and do. Let me pause a little. Whatever you do when you're dealing with people, you have to deal it from the heart. So we have another exercise, heart breathing. The heart breathing you can get from heartmath.com. So just breathe in and out like what you did before. Breathe in, breathe out. Again, in and out. Again, in. Imagine you're breathing in and out from your heart. Touch your heart area. You feel your heart beating under your heart. Good. Breathe in. Out. And the heart has some emotional qualities, you know. Appreciation, love, gratitude are all qualities of the heart. Now, put somebody in your heart that you really love. So I could put my mommy here. I love my mommy. So breathe in. And I see mommy looking at me and she's smiling. Use your imagination. You have a good imagination. Breathe in. And you want to learn this, you know, because you need to teach your children. Okay. So mommy is smiling. And if I want the heart area to feel warm, because you can have a warmth in your heart, then imagine that you are out in the sun and the sun is on your, putting the heat on your forearm. And imagine this warmth coming right across to your hand and it goes to your heart area. So I have a smiling mommy and it feels warm. Now, when this comes in useful, is like if I'm going to answer the phone, as I wake up in the morning, I can do this. If I'm going to do something that I really don't particularly like, I can do this. You know, but when we're connecting with another person, we do it from the heart. Sometimes you see people just do this, you know, so it's very important. And this is the other thing. So when we're breathing in and out from the heart, and then I can look away at a person that is not really a friend, but I can show warm regard. So the person will feel warm regard just by breathing in and out of the heart area. Can you hear me?
Yes, Doc, we can.
Okay.
But we're also perfectly on time on your last slide here as we're at the end of the time.
Okay, all right. So this is fine. Okay. So I just want you to make sure you avoid faults. No blaming, no bossing around, no bringing up of the past, no cruel humor, because you're going to talk from your heart with love and kindness. Just breathe from your heart area and do it, right? It's a learning process. You're not into getting even or hitting out or making excuses or manipulating or name calling, not listening, not taking responsibility, pushing or putting down people, or have rude gestures with your head or eyes or whatever. You're not into the shaming or sneering or threats. Guess what? We want to be able to help our family, friends and colleagues and ourselves and our animals from our heart. just remembering that people process things differently, and we need to have manners and respect to people and for people. And remember to connect with the Almighty God. Thank you so much. Over to you.
Okay, thank you so much, Dr. Buckland. Thank you, thank you, thank you. As always, your presentation is so calming. It's informative, yes, and it's very detailed, but it's also so relaxing because I don't take that time to hug myself as much, and I definitely do want to be more mindful. I drive with my music on full volume, but sometimes that's just to keep me awake. Another time I drive very silently, and it does help with the thinking and getting present. And so thank you so much for just reminding those of us who already know to take that time out to be present and to be, I love your appreciation, gratitude, and what was the L?
Love.
Love. And I changed it so that it was gal, because then I put the gratitude first and then the appreciation and the love.
Gal, okay, nice.
So I love that, gal. And so, thank you so much for sharing that with us.
You're welcome.
We actually don't have any time for questions. I'm not seeing any questions, but we actually don't have any time for that because we, in the absence of Mrs. Huntley-Jones, we have a surprise presentation from Mr. One Health himself, Dr. Paul Cadogan. So I do see a question that says, if you could repeat what SHIELD is. So we'll take that while I prep Dr. Cadogan's bio. And then as you answer that, once you finish answering that, I will just ask that you be thanked. I'm going to thank you, and then we're going to move right along.
S is for sleep. H, help for stress. I, interaction. How we interact with ourselves, or whoever, interaction, right? SHIE, exercise. L, new learning. New learning, not old learning, new learning. And D, diet. S, sleep. H, help for stress. I, interaction. E, exercise. L, new learning. Diet. Thank you. And that is going to just really help us. And this is what we need to teach everyone.
Thank you, thank you, thank you, Dr. Buckland. All right, let's see the love in the chat and the emojis. Let's see, nobody's sleeping. Who's sleeping? That was so relaxing. You guys fell asleep. Oh no, here comes the love. Here comes the love. Oh, look at all of that love. We love that, gal. Gratitude, appreciation, and love. Thanks, Dr. Buckland. All right, so let's move in right along. It's now 6:24. I hope Dr. Cadogan understands that we finish at 6:55. I don't know how he's going to do it, but let's introduce him real quick. Imagine him have short time, him saying long by. I'm kidding, he didn't. Dr. Paul Cadogan is a veterinarian in private clinical practice in Jamaica with over 35 years of experience and is a local veterinary inspector for the Veterinary Services Division of the Ministry of Agriculture, Fisheries and Mining. He trained as a One Health leader in the One Health, One Caribbean, One Love project from 2014 to 2017 and has been co-chair of the organizing committee for the annual JVMA CCFPJ One Health Conference Jamaica since 2018. He's an adjunct lecturer in the Department of Community Health and Psychiatry in the UA Faculty of Medical Sciences, MONA, lecturing in One Health since 2023, and has been involved in FMS research projects on a number of zoonotic parasitic diseases in Jamaica. He has chaired the Board of Examiners of the Jamaica Veterinary Board since 2011, administering its registration examinations, and was a member of the CAAM HP accreditation site visit team for the UA School of Veterinary Medicine in 2016. He's among the founding members of the Caribbean Sepsis and AMR Alliance, formed in February 2024, the first such alliance to involve veterinarians from its inception. And what he does not say is he is an avid gym buff If you can't tell, you look at his profile picture. Okay, there are the guns, right? He loves food and dogs, and he loves veterinary medicine, and he loves people, and he clearly loves One Health. Please welcome Mr. One Health himself. The presentation is titled Outbreak. Where is it? Where is it? Where is it? Outbreak, a foreign animal disease in Jamaica. Let's see, the emojis are going up. Clap hands, celebrations. Thank you, Dr. Cadogan, for the sake of our CEs, bringing in a new presentation at the last minute. Here we go.
Okay. Thank you so much, everybody. Thank you, Kathy, and thanks. Well, I'm going to thank everybody after this because I have to give the vote of thanks. But I have to give this presentation just off the bat like this because we had the unfortunate problem with Ms. Huntley-Jones from the Ministry of Health not being able to be here. So let's get into this very quickly. I thought this would be very interesting for many of you because many of you might not be aware that this happened. And even the young veterinarians may not know about this incident. Of course, when this happened, I was a young veterinarian just coming back from Canada, bright-eyed and bushy-tailed, and had to be plunged into this terrible event. Now, this disease, and I guess we'll get to what the disease is soon. In October 1987, there was what's called a pig multiplication unit established in Christiana, Manchester, and it was done with the purpose of breeding our native Creole pigs for helping Haiti. Haiti had just had an outbreak of classical swine fever, and they had depopulated their pigs, and they are trying to replace them with North American pigs, and they were not doing very well under Haitian conditions. So it was thought, okay, let's get some tough Jamaican pigs over there. So this was set up. And of course, for the export purposes, we had to do serological testing on these animals. And this was done in mid-1988. And 237 samples were sent to the US vet lab in Ames, Iowa. And 2 of them came back positive for Odrzeski's disease, which is also known as pseudorabies. Now, this had never been identified in Jamaica before. We were thought to be free of it. So, what's going on here are these false positives. So, of course, they were doing paired sampling. And so a further 141 samples were taken and sent. And this time, 90% of them were positive for pseudorabies. So this was active infection spreading through the herd. And that meant pseudorabies was in Jamaica. Where it come from, nobody knows. But we have an outbreak. So scary things start to happen. Now, just some background on pseudorabies. It's, as I said, it's called Odrzeski's disease or mad itch. And it's caused by a herpes virus. It bears absolutely no relationship to actual rabies. That's why it's called pseudorabies, besides some shared clinical signs. Now, the primary species is the pig. Just like toxoplasmosis is the cat that carries it and spreads it, pseudorabies is carried and spread by pigs. But it can affect cattle, sheep, goats, dogs, cats, and some wild animals. And even though they might say it's not really a risk for humans, it can happen. And it has happened that there have been human infections with pseudorabies, and it is fatal, right? So it's serious. So now we have this disease. It's one that can cause serious economic losses if allowed to spread and could attract trade restrictions in pigs and pork products. And its modes of transmission: casual contact, aerosols, contaminated feed, bedding, water, other materials, and the meat from infected animals. And moving on quickly, what it does to the pigs is age dependent. In the young pigs less than 7 days old, it's a neurological issue. So you get trembling, incoordination, seizures, and high mortality. You see in the picture here. In older weaner pigs, they get a respiratory infection, they get a chronic cough and sneezing, and mortality decreases with increasing age. In the big animals, in the sows, you get abortions. Pseudorabies is part of what we call SMEDI, the stillbirth, mummification, embryonic death, and infertility syndrome, which has many different causes. Pseudorabies is one of them. So those were the things that we probably needed to look for. And of course, because they are shared with other things, even if you might see them somewhere, you might not think that it is pseudorabies. Now, on other animals, it causes a severe central nervous system disease, and it causes intense itching. So the animals will lick through, rub themselves until they bleed. And it causes intense excitement, vocalization, salivation. That's why it looks like rabies. And with the high fever, maniacal behavior, and usually causes paralysis and death within 6 to 48 hours. So you see pictures here. Here's a cow that is salivating and bellowing. Here's one rubbing herself on a trough. Here's a dog that has scratched its mouth until it's bleeding. Now, we hadn't really seen any of this in the other animals here in Jamaica, but anyway, we'll get to that. So diagnosis would be serology and virus isolation. There is no treatment. And control, there are some vaccines, but in a situation like what we had, eradication would be the way to go. We don't want this disease here. So either depopulation or you test and slaughter. Okay, so where did it come from? That was now the puzzle, because nobody has seen anything that looked like it anywhere else. And so when it was found in the pig multiplication unit, they started doing trace back to see where the pigs came from that were brought there. And all parish veterinary officers and animal health assistants were asked to collect random blood samples from pigs in their parishes. I was in Kingston and St. Andrew at the time, so I was going out whenever I went on a call that had a pig farm. I'd collect the blood, send it back to vet division. However, nothing was being found from all these random samplings. But eventually the source of the 2 original positive pigs was traced back to where? The Riverton City dump. Right? Now, down Riverton City, I used to have to go down there from time to time to respond to vet calls. Back then, government vets, we did clinical calls, for farmers. And there were people down there who had pigs. There were pigs down there, loads of pigs, cattle, etc. And of course, all the people who rummaged through the garbage to get whatever they could get. So I was sent down there. Unfortunately, I knew people down there because I'd been there before, drove down, and there were some young pigs, some baby pigs, there. And I was able to draw 10 blood samples. 9 of them tested positive. And there it was confirmed. Pseudorabies was in Riverton City. Now, at that time, the dump had an estimated population of 3,000 people. And of course, many of them raised pigs, some had cattle and goats, and together they scavenged on the garbage. The pig population was initially estimated at about 1,500, but later it was found it was well over 8,000. And there's also the Lake Spend dump in St. Catherine that was also tested, samples taken from there, and the virus was there as well. And yes, I see the shock coming up in the emojis. Yeah, I bet most of you never knew that this went on way back then, right? All right, so here are some pictures of Riverton City back then. And you see the garbage trucks, and around the garbage trucks, you see people, and then all these little spots around here are pigs. And here's a closer image. People and pigs rummaging through the garbage. So this was a situation, and it was a really unfortunate one that it had to be that way, but these were people trying to eke out a livelihood from the dump, right? So the decision eventually came when there were 3 cows that began showing signs of the disease, and they died. The signs I mentioned earlier with the intense itching and the crazy behavior and so forth. And they were tested positive as well. So depopulation of the dumps was to be carried out in an attempt to eradicate the disease. And of course, compensation would have to be paid to the animals' owners. So submission was made at cabinet level and eventually approved. And then the media was informed. And guess what happened? And if you can guess what is going to happen here, but anyway, here we go. I don't know how many of you there remember the Jamaica Record, that newspaper that was the Gleaner's competitor back then. Rabies infected animals on the loose. Rabies infected animals on the loose. Now, this is an example of, the need for really good risk communication, because, I mean, the press, all they heard was rabies. They didn't think about the pseudo part. And beware of animals. Rabies-infected pigs are roaming the western end of the city. Right? So there was a bit of panic that may have set in because of that. So there had to be some follow-up. Right? There's an editorial from in the paper as well. Rabies infection, be on your guard. Right? So they had to correct it. Right? So it took a bit of work. I said pseudo rabies not dangerous to humans, and so forth. So Jamaica was and still is considered rabies free, but it just shows the importance of really good risk communication, and for people in the media to really have some kind of understanding of, diseases and how they occur and their importance. Okay, so the depopulation exercise had steps. Of course, this activated the National Emergency Animal Disease Committee, and the plan for which we have, the Veterinary Services Division has a protocol for dealing with this sort of stuff. So quarantine, risk communication, utilizing your social capital, and finding the money. Right? So the quarantine had to be enforced by the police and military to prevent movement of animals out of the zone, and the buffer zone areas, an area surrounding that area that is supposedly uninfected but is monitored to see what was happening. Even though we heard that, some people were shipping pigs out, at night and things like that to sell them to the, it was a jerk pork trade, the street jerk pork trade that those pigs would go into. But of course, with pseudo rabies, if the meat is well cooked, then it's destroyed. But it took a 2-month period to sensitize the people in the area. And of course, it could be a volatile area. So that needs a lot of work to let them understand the seriousness and that these pigs had to go. And so we had to use social capital. And how many of you remember Father Richard Albert? He was a Catholic priest, and he played a significant role in securing the cooperation of the community. And so, we had to go in there, and then one of the big challenges now was to figure out who owned what. Because you see that picture with all these pigs roaming around the place. Who can prove that they own what animal? But anyway, it was worked out. And the government decided that it would go through and compensate these people. So under the depopulation exercise, under NEEDCOM, the organizations, the Veterinary Services Division, the Security Forces, Police and Military, Ministry of Local Government, Ministry of Health, and Metropolitan Parks and Markets, MPM, as it was called back then, right? So these were the main entities taking part in this exercise. And this meant killing all these pigs. No, honestly, for me, this was the most horrendous experience of my life, which I never, ever, ever want to experience again, which is why I am so, adamant about preventing the illegal importation of animals and animal products, and following the protocol set by our Veterinary Services Division, because this is what can happen. So the pigs had to be slaughtered by various methods, depending on the size. And the officially sanctioned methods were euthanasia by lethal injection using euthanil, which is concentrated pentobarbital, slaughter by butchers from an abattoir, and shooting by police and soldiers. And of course, the people down there got involved to try to help, and that caused uproar. So of course, this was the news headline. Blood gore at Riverton City Police find that pigs can be elusive targets. They did not know what they were doing. The pigs were rounded up into pens and just mowed down. The police had their high-powered weapons, and we had to be there begging them, say, hold on, no, Joe, not shoot them, so you have to do it properly. Oh, God, it was, no. But the thing is, it had to be done. It was done. And 8,800 pigs were killed between January 7th and February 2nd, 1989. And see the numbers here. Over 4,000 females, almost 1,000 males, and 3,500 piglets. And these were disposed of by burying in deep trenches. And a disinfectant was used with quaternary ammonium compound. And actually, Jerry and nephew donated white rum to be used as a solvent for the disinfectant. And I remember Dr. Grant, who was director of veterinary services, well, he wasn't director then, but he eventually became director, telling me that, they had to account for every bottle. So nobody got no rum to carry home to drink. Right? It was all used in dealing with this problem. So these pigs are all buried down at Riverton City. Right? The cost of the depopulation exercise in 1988 was about $3 million. Now, when I made this presentation, I'm not sure, so it probably is more than 70 million at today's exchange rate. So you can see, this wasn't some, little exercise. This was a major, major undertaking on behalf of the government authorities, right? So in the aftermath, there was assistance to persons in securing alternative livelihoods. Fish farming was introduced in nearby areas of St. Catherine and Hill Run area, and several ponds were built. And since then, we have not identified any further cases of pseudorabies in Jamaica. We haven't seen anything that is clinically suspicious. And any testing that has been done has come up negative. But of course, we still have to be vigilant. It has to be on the differential list because we do see SMEDI, that's stillbirth, mummification, embryonic death, and infertility syndrome in pigs. But most of the time, we find that it's from other causes when it does occur, right? Now, what was the source of the original infection? Now, although this was never definitively determined, just think about it. This is in a garbage dump, right? Infected pigs were not found anywhere else but in the dump. And so it was likely from infected material that was dumped, either in garbage, could have been smuggled pork or pork products that were brought in and discarded in the garbage. You throw an infected piece of pork in the garbage, one pig eats it, and you have the whole cascade starting. Or it can also be illegal dumping of garbage from a ship in Kingston Harbor, and it made its way up into the dump area, and some pig got down onto the shore, got it. Of course, ships are not supposed to discharge their garbage into the harbor. It's supposed to be properly destroyed. So it shows that, it's an environmental issue because we're dealing with a garbage dump. It's animal health issue, it's a food safety and food security issue, it's a human livelihood issue, and maybe even possibly a human health issue too, in case there are some rare cases of zoonotic. So an animal disease outbreak is a One Health issue, right? Through and through. And the thing is, this is an example of a disease outbreak on a small scale, right? This was in a confined area. Can you imagine what it would have been like if this was a disease that had spread across Jamaica, right? And there are many diseases that can do that and do it so much more easily with much more devastating consequences, such as foot and mouth disease, African swine fever, which is right next door in Haiti and Dominican Republic. Of course, avian influenza, which is the big thing that we're talking about now with all the species jumps it's been making and getting more into people. We just had somebody die, the first US death from H5N1 bird flu just recently, and that person got it from chickens. So we have to be vigilant. And, for our companion animals as well, smuggling dogs into the country is just a big no-no. There is rabies, there is echinococcus, who knows how many of the tick fever infections, the tick-borne diseases that could be brought in by a dog that is smuggled in, the Ehrlichias, the anaplasmas, the Rocky Mountain spotted fevers, etc. So we don't need any exotic animal diseases in Jamaica, and it's incumbent on all of us to be aware, to spread awareness, and to help protect our country, right? And with that, I thank you very much. I guess I did that in reasonable time. Yep, we have time for questions and comments if there are any. And I thank you very much for your attention.
Wow. Wow. Great presentation. Fantastic. Listen, you saw the emojis going up while you were presenting, so I need not say anything more apart from I think the people liked it. There was one comment from, I believe, where is it? Dr. Marsden, who said it was originally identified at the VSD and confirmed by the lab overseas. I think he wanted you to have that point corrected, I guess, because he wanted to big up the Jamaican VSD, that they identified the pseudorabies at the time. And there are a couple parts of this that you left hanging, because you said some pigs in Lakes Pen were also confirmed positive. Did those also get rounded up and
Oh yes,
slaughtered?
it was. Remember, I said the 2 dumps.
Oh, you said the 2
The
dumps.
2 dumps.
Okay, okay.
It was everything.
And then one
actually,
person,
there was not supposed to be any more pigs brought onto the dump after that. That's why they were trying to give alternative livelihoods. I don't know how things are today, because this is now decades later, but the vigilance has to be maintained. The chemical, I said, a question about the chemical. It was a quaternary ammonium compound, but I think it was Ray and Nephew white rum was used as the solvent.
then I work at Hypro, so I get a lot of farmers in the office, and they're pigs at Riverton.
I'm sure
there are pigs at Riverton.
There are pigs back
No.
there.
So so it's just interesting to note. But we have I think we have Titus rules on pig meat, though, that comes in imported pig meat, pork products, etc.
Oh, definitely, especially with the African and classical swine fever,
Right.
which can
So
be
it's
transported so easily.
It's unlikely, because we have that stricter surveillance on imported pork products, that we will have any kind of, well, hopefully, with fingers crossed, that we would have ended up at the dump and causing another problem. But somebody wanted to know what happened to Haiti then. Did they not get any pigs?
That I'm not sure. I don't think they got any from us because of that problem. But well, Haiti did recover to,
well, Haiti has pigs, and now
because they have
to
pigs now, and
depopulate
now
again.
they have
swine fever.
African swine fever.
Yep. So I mean, let us pray for Haiti too, because I mean that country is in a lot of stuff going on, lots and lots of stuff. All right, I am
big challenge.
Trying to go through this chat. Really great presentation. This was the best presentation. Look at that. It wasn't even slotted. It was an impromptu presentation. It was the best one.
Wow.
Another one says, know your pork. know your pork. All right, so yeah, a lot of people are asking about Haiti. Yeah, they didn't reach Haiti. They did with Jamaica never bother said nothing to Haiti again. And then Christopher Donegal in the question and answer section says, good night, great presentation, Dr. Cadogan. How can we prevent this from happening again in 2025?
Well, again, it's multi-pronged. It's our surveillance, our system of imports, which the Vet Services Division is very, very strict with. We have to be vigilant at our borders, which is the difficult part. Our coastline, we have such a wide coastline, and we have boats going back and forth. We know that there is traffic between here and Haiti. So, the police have to be vigilant, Coast Guard, in terms of interdiction and looking for, animals and food of animal origin bringing in. And, then for us, there is public education to help people understand and realize. That's why this One Health thing is so important for everybody, not just us professionals. Everybody, right down to the grassroots in all those communities, needs to understand what One Health is all about. So they see the connections and see that their action, they might think an animal isn't important, right? But that animal is important in the scheme of health. And maybe when they understand that, they might treat the animal better. They might care for their environment better once they learn those interconnections. So we need some really, really strong public education ongoing, because people have a very short memory. You tell them something this week, 2 weeks later, it's gone. So we just have to keep going.
I agree. Okay, I see a number of people talking about pigs being reared in other dumps and at Riverton still. I mean, to be honest with you guys, people will never stop rearing pigs by dumps, because there is this concept that pigs are okay with eating garbage. And that even when we feed them the garbage, they'll thrive, and we'll still be able to sell them because the meat is still good. And it is a campaign, as Paul says, it's something that we will have to always be campaigning to educate people about. I'm seeing here, wait, let me see what this says. Talking about what garbage, there's too much of plastics in the Pacific, bigger than the size of some countries and deeper than the height of some mountains. Yes, this is true. I've seen it. By the Jamaica pseudorabies of 1989. What are the steps you would propose going forward? I'm not sure.
Well, the two aren't really related, but of course, the whole thing of plastics is a serious, more than serious environmental problem. And not just the plastics that are floating out. You can see the microplastics that come when they break down in the environment. And a lot of those microplastics are already in us, because you drink water, you're getting microplastics in the water.
Correct.
So, I mean, we have a huge task ahead of us to bring change and to find better alternatives. We have had some good things happen, the banning of scandal bags, but still there are a whole lot of other plastics that are out there. The scandal bag situation has helped, but it's not been the whole thing. How can we do it better? Types of plastics, the biodegradable ones, but of course the biodegradable plastics can lead to the microplastics. So what do we do?
Well, you see, as you can see, everyone here, I mean, One Health is not just one thing. It's not just one thing. It's almost everything, So I just want to say thank you again to you for coming out, you for being an audience that has been willing to learn, has been willing to be armed and equipped, not just with knowledge, but with wisdom. I mean, what's the difference between the two, right? This is the analogy. Knowledge is knowing that a tomato is a fruit. Wisdom is knowing not to put it in your fruit salad. Okay?
Good one.
So you are getting knowledge today, and you're going to turn it into wisdom, and you're going to apply it. Okay? So, Dr. Cadogan, there's someone asking you for your pseudorabies presentation. I'm not sure. They want your contact information so that you can do this presentation. Marcus Nash, you can message him privately. And I pray that everyone here has enjoyed the presentations, and I will now turn over to Dr. Cadogan, not as the presenter for this last presentation, but as the person giving the vote of thanks for the end of this conference. And really, before I go, I just want to say thank you all for having me, and I enjoyed today. Dr. Cadogan, over to you.
Okay. Thank you very much, Dr. Leon. And I'm going to pick up where you left off. You started by thanking the audience, and I'm thanking the audience first, the participants for being here. You are the reason that we do this. And we are so gratified that so many of you, turned out, and you have been so attentive, and you have been so reactive and asked all the questions and so forth. So thank you. Now, our presenters today have been amazing, right? Even though I was one of them. Professor Hassan, I mean, she was such a high-powered speaker of international repute, global repute. And she really came and shared with us. Thank her for taking that time out to share with us here in Little Jamaica, in Little Caribbean, right? Dr. Hamoonga, all the way. Well, Professor Hassan was in the US, so she wasn't in a different time zone, even though she's from Malaysia. But Dr. Hamoonga was at home in Zambia, 7 hours ahead of us. So, we have to thank him very sincerely. And I mean, both of them helped a lot. I know there is a certain person in the audience. I think his name is Dr. Hamlet Nation. Hello, Dr. Nation. I'm sure you're paying very close attention to their presentations. He's with the LHSS project. So we have to also thank Dr. Robson and Dr. Buckland for their presentations. I mean, very thought-provoking, very eye-opening for many. And of course, Aldyth always warms people's hearts, And of course, yesterday's presenters, Dr. Babulal, Dr. Maharaj, Dr. Edwards, Mr. Rowe, Professor Mitchell, we thank them again. Thanks to Mr. Francis of Nepa, the CEO, who also gave us a message yesterday. Dr. Olivia Scott for the One Health prayer, which she wrote years ago, and we put together in that little video, which we play at every conference. So we're really glad for her. And you, Dr. Kathy Ann Leon, JVMA Prezi, and I hope you see I have on my JVMA shirt too. Yes. Thank you for your excellent moderator skills. You have done well for us once again. Thanks to our sponsors. Today's presenting sponsors, Baruch Distributors and Smartline Pet Products, and yesterday's Humanima Animal Health Laboratory, One Health Laboratory, and True Pet Food. We couldn't have done this without you, and we really appreciate you being on board with us. And I have to thank my friend Adana Mahes Gibson for bringing in Professor Hassan and Dr. Hamoonga. It was through Adana that we got them. And she has been a consistent supporter of us as we have done this conference, right? Thank you to all of you who helped spread the word of the conference, helped us to make contacts to get things done. Thank you, Sam Heron of Old Gate Solutions, IT Extraordinaire. I mean, Sam just makes things work so.
And MC, he does some good MC.
And some good MCing too, and him good at coming in and saying, excuse me, Doc, but 2 minutes left. Oh yeah, Sam is a fixture in our And last but not least, to thank the others on the One Health Conference Committee who, actively helped out in getting things to where they are now. A special thanks to Dr. Alexander Thomas Roden once again for that beautiful logo, our One Health logo. She designed that. And to our treasurer, Dr. Bridget Lee Chow and Dr. Jackson Heffes for those great flyers that they did. And just everybody else who called people, who followed up, who, gave that support in making this conference another memorable event. And I mean, it's over now and I can exhale until the next one moves around. So thanks, everybody. Thanks for coming. And I'll bid you good night. And One Health, One World, One Love is our theme moving forward. So, Sam, it has been requested, so you can roll the One Health song.
Will do. Thank you guys very much. Congratulations again. And we go to the One Health song by Mr. One Health.
Our home, a living, breathing planet, but we know things aren't always right. Climate change, disease emergence, overuse of our resources. We must change our ways and look to better days, but we need an answer to heal our ailing world. Yes, we need an answer. Man, woman, boy, and girl, we need to change, but we need an answer. Health of all is so interdependent. We'll rise or fall on choices that we make. Physicians, vets, and virocides too can't isolate the things we do. We must understand health rests in all our hands. One Health is the answer. We can do it if we try. One Health is the answer. Together you and I can heal the world. One Health is the answer. When we come together and understand, united we prevail. For people, animals, and plants too, the land, the air, the water blue. Let this be our song, resounding on and on. One Health is the answer. We can do it if we try. One Health is the answer. And together you and I can heal the world. One Health is the answer. Yes, One Health is the answer. We can do it if we try. One Health is the answer. And together you and I can heal our world. health is the answer. It really is the
Thank you guys so much. We really, really appreciate you attending the One Health Conference 2025. Without you, it couldn't happen. It's been an amazing 2 days. We'd like to just talk about wrap up about the CME certificates. So for those individuals who would like their CMEs, please remember that you should complete the post-event survey that was posted. I will post it again, and it automatically pops up once you leave the webinar. Also, finally, it will also come as an email sometime noon tomorrow in your email, so you can just follow the link and fill that out. Also, remember requirements for your CMEs, in addition to your attendance being greater than 70% on each day, we're also asking that you pay a nominal fee of 1,500 Jamaican dollars or 10 US dollars. The payment details were on the flyer, also on the registration page. It will also be in the information that you see in your registration information, as well as your follow-up information tomorrow, and I will again post it. Once you have done so, please share your payment receipt. So you take a little screenshot there using your NCB, Scotiabank, or other banking app that you're using, PayPal as well. Just take a little screenshot and please share it with the email address, because what happens is payments will land and they are recorded, but sometimes it doesn't come with a note as who is actually making the payment. So if you can just share that proof of payment information, that would assist. What we will try to do is have these certificates sent out as soon as possible. We want to allow for more persons to have the opportunity to pay, so we'll try to have them sent out by Friday of this week, given that we're going to allow some persons some extra time to pay. All right. Thank you guys so much. Please be safe, enjoy your dinner, and we'll see you at the next one. Happy 2025 again, everyone. See you later.